Come to order. Hello, I'm Donna Savigny, President of the Board of Education, and I would like to welcome you to the November 18th, 2020 Board Updates meeting. In keeping with the Board's commitment to open communication with the community, this meeting is being streamed live on the CCPS website at www.carrollk12.org and broadcast live on Channel 21. We are also recording this meeting so that it can be accessed on demand on our website and broadcast throughout the month on Channel 21. This will be a hybrid meeting in which board members are present in the boardroom. However, staff will be participating virtually. We will not be holding citizen participation during this meeting, but citizens and employee groups are welcome to submit comments via email or U.S. mail to the board for public comment. Comments received will be published on our website. For board members and staff who are participating in the virtual meeting, I would remind us all to silence our cell phones and other devices around us that the microphones may pick up. Also, we should each silence our microphones when we are not speaking. Now, please stand for the Pledge of Allegiance, followed by a moment of silence. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, everyone. And with that, I need a motion for the approval of the agenda.
So moved.
Moved by Ms. Battaglia, seconded by Dr. Dorsey. Board members, any comments or revisions? No? Then with that, I will call for the vote. All those in favor, can I get a verbal aye, please?
Aye.
Any opposed? Passes unanimously. Thank you. Okay, so Section 2 is public participation, which we had said we're not holding public participation at this meeting, but any comments submitted via email or U.S. mail will be posted. So moving straight on to Section 3, which is the COVID-19 updates. Dr. Locker, do you want to kick us off?
Sure. Thank you, board members. This is a continuation of the meeting we started, a conversation we had last week. And so, as always, Mr. Singer is here to provide some updated metrics. That was one of the things that we said we wanted to follow up with. And so, Mr. Singer, if you're available and on with us. And Ms. Bowers, do we have those slides ready to go? Thank you.
Mr. Singer, are you out there in TV land? Are you possibly on mute?
I don't think I see him.
I don't see him.
Okay. Not on the participant list.
Dr. Lockhart, if I didn't know how you were going to do our dashboard, whether you're doing that before or after Mr. Singer, or if he's not on yet, do you want to do that first and then follow up with him?
We can. And Ms. Gaddis, will you check to make sure that an invitation was accepted? I believe it was.
Okay.
Sure. So, yeah, me too. Yeah.
Okay.
Ms. Bowers, will you be able to pull up our dashboard? So, while we're waiting for Mr. Singer, we sent out communication to the community about the dashboard information that we've recently added to our website. We've provided a description of each of those, and I'll talk briefly about them, and then board members, certainly if you have questions or comments, we can take that. We have staff available as well. But we also provided important links at the top of the dashboard page that go to the Carroll County Health Department for pertinent community COVID-related information, as well as the Maryland Department of Health. And I'll talk about that briefly in just a second. So there are two data dashboards. The first is COVID positive data. This dashboard looks at the number of active positive cases in each school each week that reflects students and staff. And these are data that reflect those who are scheduled for in-person attendance in our schools. So if somebody is all virtual, whether that's a teacher or a student, that's not going to be reflected here. This is just for, and this descriptor is at the top of the dashboard page, is for current positive cases for students and staff scheduled to attend in-person instruction. The data dashboard is updated every week. It was just updated again this Wednesday. And again, it reflects active confirmed cases. Once considered cleared through our protocol for return, cases are not considered active. So you might see from one week to the next, last week there was one positive case at school. This week there's 0. That means they've been cleared for return. And so we're not going to keep cumulatively, it's just the active cases. The other dashboard, and we can dive into these a little bit if you want, the other dashboard that we listed is for COVID-like symptoms data. One of the big challenges for us is that we also have to be on the lookout for students and staff who are experiencing COVID-like symptoms. And you've seen lots of presentations on that over the last several months, notably Mr. Streaker's pick 1, pick 2 sort of menu approach, if you will. We've listed that at the top of this dashboard, so all that information is there, where one symptom or 2 symptoms indicate circumstances where there's a clinical concern for COVID-19. These are not considered COVID positive cases, but they are students or staff that have to be excluded from our schools because they are displaying COVID-like symptoms. We thought that was important that people know that as well. Now, the challenge with COVID-like symptoms, as everybody I think knows by now, is they mirror lots of other kinds of things that people experience every year. Seasonal allergies, the common cold, you name it, there's probably 30 other sort of, I don't want to call them routine, but regular kinds of illnesses. And everybody here knows in our schools every year, everybody gets a lot of these different symptoms for whatever reason in non-pandemic years. But because the Maryland Department of Health requires us to exclude people displaying those symptoms in that manner, we thought that was important to people so people could have a sense. Doesn't mean they're COVID positive, doesn't mean they're going to become COVID positive. What's not listed as a dashboard is one of our greatest challenges, and that is the number of students and staff that have to quarantine because they're a close contact with someone who either tested positive or someone who displays these symptoms and has to go home. So as you can imagine, that becomes an even greater challenge because they don't have any symptoms. They are not experiencing any of the things listed there, but if they're considered in the contact tracing a close contact, even if it's a close contact of somebody who just has COVID-like symptoms, they also have to follow the Maryland Department of Health and MFDE protocols, which creates all sorts of challenges logistically for us as a system in terms of staffing our schools, but also for parents and students, a challenge there. So the dashboards, both of these dashboards, again, are for students who are scheduled to attend in person, both the COVID positive and the COVID-like symptom data. They are both updated each week to reflect active, current numbers, and they are specific to each school. So I'll stop there for a minute, and we can ask questions or make comments on that.
And Dr. Lockard, can I add one clarifying comment? So you did very specifically say, and I think it says on the top of this dashboard, that these are active, it's current active cases for kids who were expected to report to the schools, right? And what I want to make sure that the community understands, these aren't new cases necessarily. It's a different basis than how things are being tracked on the community website through Mr. Singer's numbers, right? Those are new cases this week.
Right.
of testing positive. This is a rolling current active number of cases.
Correct.
So it's a little bit of apples to oranges, but we think that this is the right way to reflect, the level, of things that are going on in the schools right now.
That's correct. I think it gives a good glimpse into who currently either has COVID-like symptoms or has actual active COVID. The other piece to that with high school data was we felt in order to be completely transparent as we were getting ready to open high schools, the data listed was for students who were scheduled to attend in person. And in some cases, maybe those students had participated in athletic conditioning or some of the pods or small groups that were happening in high schools already. So we felt like in complete transparency, they were scheduled to attend. We're going to include them in the data, out of the gate.
So, Dr. Lockhart, a question concerning the numbers as well. You were saying the close contacts have to quarantine, but we don't have a number of folks who've had to quarantine based on being a close contact, do we? The numbers don't reflect the ones who've had to quarantine?
But we don't have a dashboard for close contact quarantines. I can tell you what those numbers are, and that is our like I said, and I see Mr. Singer's just joined. That's one of our challenges. We have almost 150 staff, teachers and staff right now who are considered in some phase of quarantine because of the protocols and guidelines we have to follow, whether that's Maryland Department of Health or we don't have 150 teachers that have COVID, but we have 150 folks who are in some form of quarantine because they were considered a close contact. And you can see the number of staff identified as positive COVID or also COVID-like illness. And then the number for students is even greater. Mr. Streeker, can you tell me the number again of close contacts for students? Doesn't mean they have COVID, doesn't even mean they have COVID-like illness, but under MDH's protocol, they have to quarantine because they were a close contact with somebody who has COVID-like symptoms. That was in the 300s, wasn't it, Mr. Streeker?
Yes, 337.
Right. And that constantly changes every day. That number fluctuates, and that is as everybody can imagine, of incredible challenge not only for families and students, but on the staffing side of things for a school system to continue to stand up our schools.
And I think that's the important distinction to make, right? We don't have significant transmission in our schools. Those would show up as outbreaks, right? If there were a transmission where someone brought it into the school and then transmitted it to another individual, whether it be student or staff, that would show up as an outbreak, correct? And we have one documented instance to date. We're hearing that there may be one more soon, but we do not have significant transmission of COVID in the schools. It's simply this protocol of having to contact trace and quarantine on symptoms, on COVID-like symptoms, that is really driving a lot of the logistical and staffing issues that we're having.
Right, and that's a result of also the numbers we're seeing in the community. That's how that impacts us. That impacts us obviously you can look at the dashboards, you can see where there are COVID cases identified, students, staff, but the biggest impact to us is then what that does to staffing and trying to keep buildings open.
Right.
Everybody knows we've had to shut a couple of programs down as a result of that, and it is incredibly challenging to staff our buildings.
Right. And that's actually something that we've reached out to the state on. Dr. Lockhart, you've talked about that at prior board meetings, and it's something that's unique to the state of Maryland, correct? That in the schools that you need to quarantine and do contact tracing on COVID-like symptoms, not just a positive test.
Correct.
Right, and so you've reached out to?
Maryland Department of Health, Maryland State Department of Education, looking for some, support there, because like I said, that is a big piece of what's making it incredibly challenging to staff schools.
Right. And it's my understanding that we were expecting to get some relief from that at the state level, but because that would alleviate a lot of the logistical staffing issues, correct? But we haven't gotten that relief from the state.
I would say that would help, but we have not gotten that relief.
Okay.
And I think it's correct, you'll tell me if I'm wrong. That's not required anyplace else.
Not
That's
that I'm aware
schools.
of.
Yeah, businesses don't have to do it, other activities don't have to do it. So again, you're not asking to get away with something, you're asking just to be like everybody else.
Right. I mean, if, all things considered, I really wish our community cases was way lower. I wish the positivity rate was way lower. I wish all this was gone away. But I think we'd have a greater success to provide a more consistent education to students when in a hybrid model, if that were like you described, Mr. Carter, like it is for everybody else. I certainly, we're doing everything we can to be as safe as possible. The mitigation strategies, I'm not going to speak for Mr. Singer, but I think he would agree that we do a very good job of masking and social distancing and hand washing and everything we can to reduce any kind of transmission. But we do see cases, and it does not help us at all, the community numbers, which is why we're here this evening having this conversation.
And I don't know whether this would be the right time to do it, but can you talk about how this is really impacting the staff at the school levels and the central office staff as well?
Well, I can speak, generally here. What it means is we are, it's nothing short of a miracle every day that most of our schools open based on the limited amount of staffing we have. When you take 150 people off the top of what already exists, you're scrambling. We've already plugged in everybody we can. We have central office staff out covering buildings. I feel it's a bit of a disservice ultimately to everybody. And then I feel it for our students because they might have a different person standing in front of them when they do go into school. And that continuity of instruction is jeopardized because of that. So we're, in some cases, robbing Peter to pay Paul to try to keep things stood up. In some cases, it is not. It doesn't have the best educational value. I'm not going to argue with anybody about the benefits of actually physically being in school. We all think that's best for kids. Everybody wants that. But because of where we are with numbers now, and because of the amount of quarantines that are starting to happen, it makes it that much more difficult to stand up a quality product.
Dr. Locker?
And does it make sense? Was that Ed Singer? Does it make sense to transition to Ed? So Ed, thanks for joining us.
Can I do one more question on this? And Ed probably has comments on this too. You mentioned outbreaks. Mm-hmm. And there's possibly some people notified today. To me, it's great that we've only had 2, but can you define what an outbreak? To me, an outbreak sounds horrible, and this is all horrible, but it could be 2 people. It doesn't mean a whole bunch of people. Can you define what that is?
I sure can.
Are you okay to say where it's happened?
Sure.
Okay.
Ms. Bowers, do you mind going back to the dashboard page you were on and clicking on the MDH outbreaks page that was up there for us? So the Maryland Department of Health describes an outbreak in a school setting as 2 or more related positive COVID cases, and it's the next one, the MDH school outbreaks, right there. And this is right on our website, right where our other dashboards are, and this is publicly listed information, and they update this every week. And so you can see of all the schools in Maryland, public, private, charter, whatever they might be, they will list the schools, the number of cases, so you're not going to ever see a 1. It's going to be 2 or more related. And what that means is, through contact tracing, and Ed Singer or Carroll, if I don't get this right, you can correct me, but through contact tracing, it's determined that transmission happened at the school between those two people who had close contact at school. So in other words, if you're in a class on the, down the hall on another floor, and you get COVID, and somebody way on this wing in another class gets COVID, and neither of the two have close contact or anything, they're not going to be considered an outbreak. But if we're, for example, in the same class and a teacher has COVID, and then it turns out through contact tracing that a student in his or her class has COVID, through that contact tracing, if that's determined that that's where the transmission occurred there in the school, they'll list that. And so you can see the varying degrees on different pages. There's other schools on 4, I think, more pages there that show anywhere from 2 to, 16, depending on what the size of the outbreak is.
Does that answer your question, Mr. Kyler?
I mean, yeah, and so for instance, one was Robert Moten.
Right.
And it now shows as 1 case last week and 0 now, so it was in the past, it's over.
Right. Robert Moten's will likely come off this list this week. I think they update theirs on Thursdays. I don't know. That says last update 11/18. That should be coming off because according to our records, that outbreak is concluded.
Right, so the staff member is back, the
Yes.
student is,
I'm not exactly sure of the
covered.
student. I know the staff member has been cleared.
Okay.
So I'm not exactly sure, maybe Mr. Singer knows, when they clear that out of their system at the state, maybe there's a little bit of lag time there.
okay.
I have a question.
Is-
We have a number of teachers, as you said, maybe 150 that are asked to be quarantined right now, correct?
Yes, I think the actual number as of today is 147.
Right. Are we doing anything to offer those teachers that might want it some type of rapid test, or get them to the health department with a particular time slot so they can be tested so that they don't have to worry about it for 2 weeks? Do we have any kind of relationship with the health department to do that through the school system, or do you have anything with your nurses or anything set up?
Well, I can look to Mr. Singer to answer that question.
Mr. Fraser, if I can address that. First of all, if you're in quarantine, doesn't matter how you test. What we're looking at is the disease has a process of up to a 14-day incubation period. So if you're exposed on day 0, starting day 1 through day 14, you could potentially become sick. And just because you test on day 2 or 3 or 4 or 5 doesn't mean that you're not going to be sick on day 7, 8, 9, 10, or 11, 12, or 13, or 14. So while we recommend that people get tested just to kind of find out what their status is, somewhere between 4 to 5 days is when most people will incubate the disease and become sick and start shedding it. We recommend people get tested. It doesn't get you out of quarantine. So if you're in quarantine, you have to be in quarantine for the entire 14-day period, unless you get sick, and then you go into isolation and you have to be medically cleared through that through that process. So the testing, the only way that testing helps is if you have somebody that you suspect has COVID, and we put people in quarantine because they've had close contact with that person, that if the person who was suspected of having COVID tests negative, then the rest of those people can come out of quarantine. So testing somebody in quarantine doesn't help, but testing somebody who's suspected of having COVID that causes other folks to go into quarantine does help.
Thank you.
That's where, okay.
Mr. Fraser, you were saying to give them peace of mind or to help them get through quarantine quicker. Both?
No, I wasn't saying to give them to help them get through quarantine quicker. They should be quarantined for the entire 14 days. But if you're going to be within, my understanding was 5 to 7 days, if you got a test in, and if you're positive, it would probably show something at that point. Perhaps I'm wrong about that. But, if you have the test within 5 to 7 days and it's positive, you have it then, okay. But if it's negative, you probably feel a lot better about staying in quarantine for the rest of the time. You're not quite as worried. So therefore, I was thinking maybe the school system could work with the health department to get these teachers some type of testing at that period of time. just to help them out, just for the mental stress.
Gotcha. I thought that's what you meant. Thanks.
Okay, so Dr. Locker, does it make sense to have Mr. Singer go through his dashboard now? Okay.
Can before we get into the PowerPoint presentation, I just wanted to mention a couple of things. And one is we got notified by our lab today. Some of the things that the governor did yesterday is going to have some impact on our lab turnaround times. We got notified by our lab today where we've been getting a 24-hour turnaround time from the lab. Our turnaround time is going to be 48 hours on this testing, so that's going to slow us down a little bit. We've also been inundated with the number of folks that have wanted testing recently. We expanded our capacity from 150 up to 225, and we're looking at expanding the capacity of 250. But sometimes we're having a delay of a couple of days before we can get folks tested as well. So that's slowing the process down a bit. But we're doing the best we can to expand our capacity and make testing available. And we are prioritizing certain folks if we know somebody needs to be tested because it's going to get other folks out of quarantine. We'll do our best we can with that. The other problem is we've been booting some of these calls to NORC, and apparently the state's contracted call centers having difficulty keeping up with some of these community contact tracing cases, and they're not able to make all the calls in a timely manner. Either we're bringing more people on board. That should happen within the next week. We're ramping up, but as you'll see on some of these charts tonight, these cases just all of a sudden spiked up I think in a manner that nobody was expecting to move up that quickly. I know we were all expecting to see an uptick in cases, but it's gone up exponentially over the last couple of weeks off the chart. So if you want to go ahead and start with the PowerPoint presentation, we'll go ahead and talk about that.
All right, he's getting ready to put that up for you, Ed.
Okay, so we have it on this screen here. Can the public see it?
I can't see it.
Okay.
That might be important.
Are we working on that?
We are. We're working
trying.
on it.
Mr. Singer, while we're waiting, I have kind of a dumb question. If somebody goes to their family doctor and gets a test, what kind of test are they getting? And is that as valid as if they come to you?
So it depends on the doctor and what they have available. We've suggested if somebody's symptomatic and they test positive with a rapid test, we're almost 100% sure that person has it's what they call a rapid antigen test, which is different than the PCR test. Which what we do is we do PCR tests, which would test for the DNA of the virus. The antigen test is a little bit different, and it's not 100% as reliable. But if somebody's symptomatic and they test positive, we consider them to be a presumptive positive case. And a lot of we're trying to actually expand the capacity to get this done in the physician's office, even though it's not counting in our metrics. What we're asking the physicians to do is also send out for a PCR test, because that could take a couple of days to get back, especially now that the nursing homes are having to do more testing and there's a lot more demand on the private labs, and it's slowing down turnaround time. It makes sense to do in a clinical setting to do these rapid antigen testing that at least get an initial read as to whether or not the person's positive. If they're negative, that doesn't necessarily rule it out, and it definitely needs to be confirmed with a PCR test. And quite often in the doctor's office, they can do right there. They can collect the specimen for the PCR test, and they can do a rapid test, and they can run the rapid test right there if the physician has the capability. And we've been trying to get more of that capability out to the physician's offices. but they can also send the PCR test out to one of the private labs that are doing these PCR tests. That's not something that's normally done in a physician's office. It requires a lot more intensive laboratory work.
So,
That
Mr.
help?
Singer, you had said that, when the rapid antigen test comes up positive, you're almost sure that that is a correct positive. But do you have any feel for what the percentage of false negatives there are?
There's some data on that, and I don't have it in front of me, but there are we've actually had cases in Carroll County that I can talk about that anecdotally that I know about where the person has tested negative on an antigen test and then had a PCR test and it came back positive. If somebody's symptomatic, the test is really good for confirming that they're positive, but it's not as good on the negative side of things. So I don't remember what the percentages are, but there was a fairly large percentage. It was up at one point in time, they were looking up to as many as 30 or potentially even 40% of the negatives for somebody who's symptomatic could be a false negative. I don't know where that number stands now. The last I looked at that was about a month ago. So I can't really give you an accurate answer on that.
Okay.
Bob, I can share my screen if that works. I have his presentation up.
Just 1 second, I think.
And Ed, when you were saying that you were trying to get to 250 cases, is that per day for capacity?
We're testing on Tuesdays, Thursdays, and Sundays, and that's per testing date. Those Tuesdays, Thursdays, and Sundays. We were at 150, and we weren't nearly meeting that. I guess 3 weeks ago that we had a capacity of 150, and all of a sudden with the uptick in cases and a number of people that were sick and whatnot, there was a lot more demand for testing. So we quickly added an additional lane and added additional capacity to do additional tests.
Okay.
So 3 days a week at the Ag Center site. Now people can also go, if they get scheduled in CRISP, they can go anywhere else in the state that they want. It's just we're trying to keep it as convenient for our residents in Carroll County as we can and provide the fastest turnaround time as we can, so we're not unnecessarily keeping people in quarantine. If you can go ahead on to the next slide. Okay, this is kind of our dashboard for this week, and looking at the total cases per week for Carroll County population, we're at 231, which you can see that's huge increase over last week, and we're probably headed for a similar week. We're already in the 150s this week in total cases in Carroll County. To put that in perspective, it kind of, somebody suggested I try to put it in perspective. Some of the days last week, we were having more than, if you figure it out over a 24-hour period, an average of over 3 people becoming infected per hour in Carroll County, and that's a lot for a jurisdiction our size. So we're essentially in what would be classified as uncontrolled spread of the virus in Carroll County. This place we haven't been before. Total cases per day per 100,000 population, it was 19.6 as of last Saturday. I don't have my notes slide with me, but we're about 23 right now, and I know talking and moving to the next metric on here is positivity rate, which was 5.5 as of last Saturday, stands at 5.7 today. I'm trying to put things into perspective from a practical standpoint, and we set this thing with the ICU beds and the days where they're exceeding 10, and some of this is driven by COVID. But I think to put this in perspective on the strain that this can put on the hospital system is, they're averaging. I was taking a look at how many people who were suspected of having COVID or who had tested COVID positive were actually admitted to the hospital on a daily basis. And right now, that number is averaging somewhere in the 30s of people that are in the hospital that wouldn't otherwise be hospitalized for COVID. So that does have a significant impact. Our hospitals capacity, that's about a fifth of their total bed capacity that is just dealing with these COVID patients that wouldn't otherwise be in the hospital. Community deaths per week is we had one last week. We've got one that's pending that'll be coming up this week. So next slide, please. We've been watching these metrics in the cases per week and total cases in Carroll County, kind of comparing this to the CDC metrics. And as you can see, since I guess late October, we've all of a sudden had this huge spike in cases that has just gone almost straight up. We've gone from 65 cases to 231 cases over the period of just 3 weeks. And as I said, we're in the mid 150s already this week, and so we're looking at a similar or higher week again this week. Next slide. Kind of comparing things to the state metrics as far as the case count per 100,000 that the Department of Health and MSD and the governor's office had put together. We were at 19.6 as of last Saturday. As I told you Wednesday night when we were sitting in the meeting, when we got by the time we were putting our data out the next morning, we exceeded 15 that day, and we're up around 23 right now as of today, 23 per 100,000. Next slide. It's just our community case count as of last week, and this is just the community cases. There were 214 out in the community. Next slide. And then there's this additional, when we talk about that rapid antigen test that we were talking about before we even started the slides, there's an additional 36 cases that that weren't confirmed with a PCR test, but were positive on a rapid antigen test, where that's almost entirely accurate on diagnosing somebody with COVID. So there's 36 additional cases that aren't even being counted right now. Next slide. It's just our 14-day rolling average, and obviously it looks like a lot of the other graphs that we've been looking at with that steep increase. Next slide. Just the COVID deaths by week that I share with you each time. Next slide. It's kind of shown a little bit of the stress on the hospital. Last week was not great for them. ICU-wise, they're doing better this week, but they are, in talking to Garrett, the president of Carroll Hospital Center, Garrett Hoover, he's kind of told us they have more PUIs and more COVID positive in their overall hospital census this week. Next slide. And then again, we're continuing to see the number of pediatric cases reach record highs for us. If you look at that red bar there, you can see it's climbed up and up and up, and we're in the 30s as of last week, and we're still seeing a lot of pediatric cases continuing into this week. So that's your under 18 population. Next slide. And this is just a slide that kind of shows where those things have been. We're at an all-time high for those pediatric cases under 18, and I think we're also at a high for the age group 18 to 29, and that's some of your students too. I know we have a lot of high school students that are now 18 and 19 years old, and that's some of your student population, and also a lot of our college population there. So we're at an all-time high for that age group as well. Next slide. Just a reminder, we're getting into the holidays, and especially with Thanksgiving and all that, the important thing is I keep reminding people, if you can do things outside or do things virtually, and I know the mental health piece of this is something that the board has talked about on a number of occasions, and I want to make folks aware that you need to have that interaction with family. And if there's a way to do things virtually or to make it safer and do things outside while we're in this huge spike in cases, we want everybody to be safer. Obviously, the governor's put new restrictions in place in a lot of places and whatnot. So the outside type of thing, if you can, and if you can't, doing some type of virtual engagement is a good thing to do. The health department does have a mobile crisis team, and you can call that mobile crisis number and get support there. We have crisis intervention teams that are available. There's supports available by calling the health department, and we can certainly link anybody with behavioral health support that they need to try to get through this thing. I know a lot of folks are suffering with just the overall dealing with the pandemic, but we're there to try to help on that extent too, as well as we can. Next slide. Just reminding people to wash your hands, keep your distance, do the right things, avoid those large gatherings, especially indoors, and do the best we can to get these numbers down so that we're moving back in a positive direction, so that we can get things fully reopened and keep things, business, community, school wise, and everything going in the right direction again. Thanks. That's all I have, and I'll be glad to answer any questions at this point.
All right, so board members, questions for Mr. Singer?
Mr. Singer, I do appreciate you bringing up the mental health piece, because I know that, we are starting to hear more and more about that. The governor brought it up the other day, and I do appreciate you making sure that you have put out there the resources that the health department offers, as well as I know CCPS has our resources on our website as too, for families. So I do appreciate you bringing that up, because it is something that, that they are starting to talk more and more about in the news. And we do need to make sure that information is out there for everyone. It's definitely not getting easier. It looks like it's getting uglier. I did bring up last week, and I just kind of want to touch base again on the age regarding the 45 to 64. Is there anything that is bringing that on? I mean, is there outings? Is there something that's happening with that age group that's gone up dramatically too?
Well, I'd have to go back and look at those slides again, but I think that that age group's generally been fairly high, and it's a pretty broad range of an age group too. I think that we've been talking a lot about where we're seeing people get this, and it's mostly at those family gatherings and sleepovers and things like that are home, and we all need to be cautious, because regardless of who we are, you just have to. The one wrong person who happens to have this disease could spread it to the entire group, and especially these times where we want to gather as families and get together. That's what's most concerning. I really don't think that age group is as upticked as much as our groups in the pediatric category and the younger adults that are up to the age of 29. I think that they're just higher because the cases in the community are higher altogether, and we're not seeing as much of a spike, I don't think. And if we want to go back, we can go back and look at that one graph I have that has all the different. I don't know that it's necessary, but if you want to go back and look at it, it has all the different age groups, and it kind of shows the ones that are ticking up the most versus the others. And I don't think that one's as huge a concern as the fact that we're seeing this increasing in the pediatric population, and again in that 19 to 29-year-old age group.
Are you seeing the same type of things in the private schools as well? Are they having issues?
No, I mean that. So when you talk about issues, everybody's got staffing issues. They're running into the same type of staffing issues and things that you are, and the same problems with the PUIs and the people that they're having to put in quarantine or isolation. So yes, we're seeing those same types of things there in those locations. They're not immune from it because they're private schools. I do think all the schools, and I've said this before, and I think Dr. Lockhart mentioned it tonight that he's heard me say it, and that is, I think the schools are doing the best that they can to mitigate this disease in the classrooms when we're in teaching. The problem is right now with this uncontrolled community spread, it's just we're off the charts on every type of metric that you'd want to look at as to what's right for having schools back in person. It's not being caused by the schools. It's being caused by other activity outside the schools. But now it's such a rate in the community that it's really difficult for us to operate and to work with the school system when we have this many cases and this many people that are potentially infected with this virus.
Do the private schools reach out to you like we do? Like, do they ask for dashboards or anything like that regarding the community?
They're not asking for data on a regular basis, but we post all this on our website. And I know I've talked to some of the headmasters at a couple of the schools because the first outbreak we had was in a private school, and I've talked to the headmaster there and several of the other schools, and I know that they look at the data that we post on a regular basis. Our PIO updates a lot of the data on a daily basis, and some of these charts that we share with you are shared publicly on that on the health department's website so that people can have access to them.
Thank you. I really appreciate that, Mr. Singer.
And Mr. Singer, I really appreciate the distinction, right? It's not the schools that are driving the transmission of this in the community. I just want to make sure that folks understand that. But the level of transmission that's in the community will eventually start rearing its ugly head, and that's what we have to manage. And it is causing, and the different contact tracing protocol that the schools have in terms of, having to quarantine folks that have come into contact with COVID-like symptoms, not a COVID positive test, that is really wreaking havoc on our staffing. And that's what's leading to logistical problems, obviously, with the staffing and us being able to deliver a consistent classroom experience to our students.
And Ms. Savigny, if I could just chime in here on that. And I supported, as Dr. Lockard knows, I supported trying to get the Department of Health and MSDE to change the guidance so that it is more consistent with what we're doing out in the community. The one thing I do want to mention, though, it is a little bit of a double-edged sword because, if we're not quarantining folks that are exposed to somebody that has a COVID-like illness, there are going to be a percentage of those people who would have tested positive, and we may see more outbreaks, but it's, that percentage may be small. So, and again, we're following these protocols. So even with the outbreak that we had at the one school, we weren't talking about multiple cases. We're talking about one person gave it to another person, and that's considered to be an outbreak. And I know Mr. Carroll brought that up earlier, is that, what does an outbreak mean? And I think, two things that we need to be happy about that we're doing in the schools. And I'm not saying that this means that we should keep schools open right now, because I am extremely concerned about our rates of community spread right now. But the two things that are working, must be working effectively. We're not seeing outbreaks. So that tells me the mitigation measures are working. And when we have seen the occasional outbreak, it's not more than one or two people that are catching the disease from somebody else. So these things must be working, because we know we've got this uncontrolled spread in the community, and the things that are happening in the schools are not causing this to spread more.
When you're doing the contact tracing in the community, are you seeing, like with a gathering or with a certain location, do you end up seeing like 6, 8, 10, 12 cases, or is that 1 and 2 here and 1 and 2 there? Or are there clusters, or not really?
So I'll tell you, we've seen clusters from, and the one that stands out most in my mind was a bunch of younger folks that basically had a sleepover type of thing, and we wound up with 9 cases out of 9 people who were involved. So I mean, that's kind of the highest type of rates of transmission you can get there. We're also finding, I will say that when we're talking about people who are living in the house together, regardless of what measures people seem to take to try to isolate the person who's sick, we're finding that usually almost in most cases the entire family gets sick. You've got to be really cautious if you're going to keep it from spreading within the household. So, yeah, quite frankly, the household contacts are almost always going to wind up contracting the disease in most cases. So we're not seeing the ones or twos out in the community so much, because I think it's because people feel comfortable with who they're around in these social gatherings. And while the person may look healthy, where most of the transmission is that we're seeing, I think, is from people who don't have any symptoms, so they're asymptomatic and don't show symptoms of the disease, or people who are what we call pre-symptomatic, because you can shed the disease. If you get sick and you actually have symptoms, often you're shedding the disease a couple of days before you even start showing those symptoms. So I think most of the transmission we're seeing is people who might appear healthy are giving it to other people, and that's where this quarantine and isolation stuff becomes so important in trying to limit the spread of the disease in our community.
All right, so board members, do we have any other questions for Mr. Singer, and do we want to keep him on as we continue our discussion? I think it might make sense at this point to kind of do a round robin on our comments. And Dr. Lockard, and if you have a recommendation, and then we can do a round robin with our comments. Does that make sense, board members, to go in that fashion?
I do have one quick question. Mr. Singer, here, so we constantly hear, they do the test up the nose, but we wear the mask because of droplets. Are they ever going to do, why can't they do a test from inside the mouth? Because that's something I do hear a lot, in a lot of questions, and it seems a little silly, but I think it's, sometimes it's also, people are afraid to go get a test because they have to go up inside your nasal cavity. So I think, can you explain that a little bit?
Well, and I'm not the expert on this testing methodology, but I'll give you the best I can on this. It does generally you're going to get the most accurate reading as to whether or not somebody's infected with the nasal secretions, and if somebody's coughing or sneezing, that's when they're giving off those droplets that are problematic. It's not generally transmitted in saliva, although there are salivary tests that are being developed out there. I don't know that there are any that have been approved for use yet. And we may see testing evolve as this moves along. There are mid-and-air tests that are available. That's not what we're using, but some of the other places like pharmacies and some of the urgent cares are using things that don't go as far up in people's nose. So if people are concerned about the type of nasal swab that we're using, if they look for, actually on our website, we have information about all the different testing resources that are available out there, what those tests are good for, and potentially where you can get some of those type of tests done. So the mid-and-air tests don't go as far up in the nose. So if people are not getting tested because they're worried about how far up in the nose the swab goes, that may be the best alternative at this point in time, because we don't have good salivary tests that I'm aware of that are out there that are ready to go, that are approved.
I have one more question, and back to the chart you referenced with the lines, and it's the real high one is the 45 to 64, and then it drops down to the 18 to 29. What are you seeing with serious cases? What age groups are you seeing those in, and have they spiked as much as the cases have?
So, the hospital data we look at on a regular basis, hospitalizations are kind of something we've been looking at. And yes, it is really people with pre-existing medical conditions and the folks that are elderly. And we talked before at a previous meeting about how often we see these the spikes in the older age groups kind of follow the younger age groups. We really saw, I don't have the chart in front of me right now, but there was one point in time where we saw a real spike in the 19 to 29-year-old age group, which was followed within a week or two of a real uptick in the population that was over 65. And our real concern is about, while we understand that, most, and I'm not going to say none, but most of the younger people can tolerate this much better, especially the kids that are elementary school age. It gets a little more risky when you get into middle school and high school age, and they have the disease more like adults. But obviously, people with pre-existing conditions are more susceptible to poor health outcomes, and the elderly have been very susceptible to this. The one thing I will add, though, is we've had a lot of discussion about what is the long-term impact on the scarring and things that this type of infection in the lungs will have on people in the long run, and people who have had pneumonia and things of that nature previously, as they get older, they tend to have more respiratory issues as an older adult. So while it may not have seemingly as much of an impact on the younger people now, what impact it's going to have in the long term over their lifespan is something that we don't know enough about, and I would suspect that it's going to have some impact. I just don't know how great an impact that's going to be.
And then, kind of unrelated to your presentation, but I don't know if you've heard much about this. It looks like we may have 2 or 3 vaccines, maybe even a month from now. I do know technicians that are already being trained and told they're going to go into maybe care facilities in the middle of December. Have you heard much about that? Do you see? I'd heard that, of course, care facilities, then maybe health professionals, essential people, but even though educators aren't considered essential, technically, that they might be a high priority to get a vaccine. Have you heard any of that?
So we've been in the planning process, and the health department will be very involved in the rollout of the vaccine. Obviously, the first wave is going to be for those most susceptible populations that are in our long-term care facilities and things of that nature, and then our first responders and healthcare workers. And after that, yes, I know that there are prioritization groups that the federal government is working with states on determining who they're going to be and who's going to get the vaccine first. This first wave of vaccine, it's going to take a long time to produce enough vaccine to vaccinate a lot of our population. So I would anticipate we're going to see people starting to be vaccinated probably next month. And it may be a couple of months before we get through this first phase of getting people vaccinated and move on to the next stages. So you're probably talking springtime if the teachers are in a priority group, which I expect they would be. You're probably talking sometime late winter or springtime before realistically you're going to see folks in those types of categories getting vaccinated. It's going to take a while to produce enough vaccine to move on from the first phase to the next phase.
All right, board members, any other questions for Mr. Singer before we hear a recommendation from Dr. Lockard?
So, board members, in following the discussion last week, re-examining the metrics this week, I continue with a recommendation that we do need to pause hybrid instruction at this point in time. When we look at the guidance that we have from the Maryland Department of Health and MSDE, we are greater than 15 per 100,000. We are greater than 5. That puts us in a limited or no in-person program category by quite a bit. I have the same concerns Mr. Singer does, while I am so appreciative and applaud the efforts Carroll County Public Schools has done more than any system in this state in terms of bringing students in at the volume that we have, and I don't want to give up on continuing to do that. I hear from students every day, I hear from parents every day, I hear from teachers every day. We know the importance of getting our kids in school, and so while I completely understand the heartbreak this causes and also the strain it provides, I also am thinking in terms of the greater community health and getting through this surge to get us to a place where we can get back to in-person instruction in a way that meets the metrics in front of us. And so similar to Ms. Battaglia's conversation last week, I would recommend that we pause hybrid learning at the elementary, middle, and high school levels for a period of no less than 2 weeks to reevaluate that the Wednesday after Thanksgiving. That would be December the 2nd. We have a budget meeting that evening, a preliminary budget evening. We could follow that with a follow-up meeting with updated metrics and continuing to look at our next potential steps. I don't want to leave everybody hanging with what's going to happen next, but I also don't want to write off months and months, because if we had done that back in September, we never would have had elementary, middle for almost a month or so, and a little bit of high school. I know that wasn't what we had hoped for, but if we had written that off, we never would have done that. We are in much better shape than just about everybody else because we've experienced that. Yes, I know there are things to improve. Yes, I know we can do better. We're working on that constantly. But the fact of the matter is, not just the community health components and these metrics, but the fact of the things that I spoke about earlier, the impact that the community spread is having on our ability to maintain our operations in a consistent fashion that's fair to students, that's fair, that's the kind of product we want to put forward, is concerning. I do think we can still have conversation about some limited programming, and I'm certainly willing to have conversation about that, but that would be my recommendation to you at this point.
Okay, and I think, Dr. Lockard, we definitely would like to talk about what limited in-person small groups could look like, right? Like, what are the things that we could potentially keep open? Things like career and tech, the small groups for special needs students, potentially Gateway.
Anyone, IEPs, variations of need through IEP, I think, is important too.
And kids who don't have good connectivity that are coming in for pods right now, like those are kind of categories of things that we'd like. I think, board members, are there others that we would like to have a discussion on?
We were questioning about the students getting some kind of tutoring or academic support.
Okay, so we have those categories, right? So does it make sense to pick those off individually? So if we have a discussion about career and tech, we'll go through each one of those groups.
Could I add another group or two to that discussion?
Sure.
Besides career and tech, the LFI students, the students that are in BEST programs, students that have accommodations. But it has to be emphasized that if any students are coming for in-person teaching, they have to wear a mask. If for any reason they cannot wear a mask, and there are some logical reasons, that's fine, but then they don't come for in-person teaching.
Okay, I mean, I think that makes sense to add them to the list, and then Dr. Lockard, if we could talk about the logistics and feasibility of that as well. I think we probably need Mr. Streaker to address whether that's doable or not,
Right, and Mr. Shockney. Yep.
and Mr. Shockney. Okay, thank you, Commissioner Frazier, and board members. Any other groups that we want to discuss?
Mr. Anderson, at the very beginning, when we opened up the schools, you had a list, and you wouldn't by chance have that close, or are we missing anyone on that list? Because that was a great list, and where we started out with the career in tech, and then we got them in by weeks and weeks, and then Gateway and Crossroads, and then we started in with the special education and LFI. Are we missing anything on that? Pride, Best? Are we missing anything on that list? Because I'm trying to think off my head.
Yeah, that's a great segue. So we you are correct. We scaled that up. We started with, as you know, we started September 14th. Well, many weeks ago, where we began to bring in, as Commissioner Fraser is referring to, some of our specialized programs as well as our CTC students to make sure that they could stay on their pathway to meet the requirements for their certifications, endorsements, et cetera, for the industry standards. And so, yes, that's exactly what I believe Dr. Lockard was referencing as well. And Mr. Shockney and I have had those conversations. And that would be something, if the board was interested in making certain that we continued. To your point, Ms. Herbert, those programs that we scaled,
Right.
We feel comfortable and confident that we could continue with those small specialized programs, as well as continuing with our programs taking place at the CTC. So you are 100% correct, and that's right on point with what we're thinking.
I know it's on my phone somewhere, but I know it'll take me a minute
Yeah.
to find it. But that was a fantastic list, and that included all these people. And I just don't want to, if we go around and pick and choose or whatever, I want to stick with that list because it was in sequence and it worked out very well. So that's the list.
Yes, I know Mr. Shockney is on the call this evening, and Nick, I didn't know if you wanted to address some of Commissioner Fraser's comments as well. When we're talking about our specialized programs, LFI is one of those programs, Commissioner Fraser, that you referenced that we were planning and thinking about as well. Nick?
Good evening, board members. Yes, so we started off by phasing in essentially our six, what we call our special programs. And that included our autism program, including our preschool program, our BEST program, our Learning for Independence program, Carroll Springs School, and our PrEP program, if my count of six is accurate there. We very well, at your direction, can continue to implement services for students in a hybrid model within those programs. I will be candid with the board. We have had significant impacts to staffing in those, not only in those specialized programs, but just in resource special education as a whole. We've had significant staff out on participating in that in our COVID protocols. So
Well,
it has
Nick,
had an impact.
Nick, that's what I was gonna reference. I don't mean to interrupt you, but I think it's important to state that when we're talking about limited programs, of course, we're still operating within our protocols, and everyone knows that some of the specialized programs require a little more close contact to support the needs of students. And so we have had occasions where we've had to stop or pause some of those programs. That means that potentially could happen in the future. I just want to make sure everybody understands all those things still apply. Yeah.
Thank you, Dr. Locker. And we've been very upfront with families that, especially in our specialized programs where we know some of our students have very specific needs, it is not possible to implement those from a social distancing perspective. So obviously those are our students in our special programs that have some of our most intensive needs. But to be able to do that, there are often times where we are within that, I call it the bubble of that student. We can keep students separate, but our staff oftentimes are going to engage with that student within that bubble. We protect staff. There's PPE and we have practices for all those things. However, it does come with risk, and I just want to be clear and upfront with families that still continues to be a risk. But there's been overwhelming feedback from our families since our meeting last week that in-person instruction is essential for our students with disabilities.
And that is so true because we've been getting it also all the time. You know, they need the one-on-one, they need the in-person instruction, they struggle and lose contact during a virtual class. So that is so true. And believe it or not, Mr. Anderson, I did find your email, and I think I think we're hitting all the classes that we need.
Yes, ma'am. And Ms. Herbert, the other piece, as you know, what's on that information sheet that I provided was that our CTC programs, and I know that Cindy and Eric are prepared to talk about that as a potential option as well to maintain if the board decides to.
Mr. Anderson, what about our ESOL students? Are we making sure that they are kept on track, that they're getting the help they need, and the at-risk students?
Yeah, so to speak specifically about ESOLs, as you know, we have an amazing resource group of teachers that have gone above and beyond as far as doing home visits and working and building the community engagement necessary for our families, and to support that as well, our Office of Interpretation and Translation has done an amazing job. I can't even begin to tell you how we have surpassed the numbers of families that are reaching out to us, and we then responding and providing reciprocated relationship, that we're making sure that all of our students, specifically our ESOL students, are staying engaged and their families are aware. It's been an enormous amount of work, as you can imagine. Just think about how we've been communicating in English, and then go ahead and put another language or two or three different languages to make sure that all of our families across our county are aware of what's taking place and how we can support them to make sure their students are engaged. For some of our other students that I know President Savigny had mentioned about students that are struggling with connectivity or access, and we know that our technology services has done an amazing job of providing hotspots and devices. But the reality is that I know our high schools in particular have done an amazing job of setting up pods to make sure that we're bringing in students that they may have access, they may have connectivity, however they need additional support to make sure that they are staying on task, doing the best they can, and getting the academic support when needed. So I'm going to be completely candid with you. The amount of work that requires is enormous, and I think that we've done as a system we've been amazingly responsive to all of our families and students. But the reality is that it has not been a typical learning environment since March of last year. And so what I'll say to you is that I know our school directors have been working with principals to figure out virtual as well as some face-to-face, and I don't know if that's going to be a reality if we go this direction with the face-to-face, but the enhanced virtual tutoring times have been set up. I know schools have talked about trying to develop a night school. I don't know if that's going to be a possibility. I just want to go ahead and say that we are doing amazing things and keeping all of our students and families engaged to the best of our ability at this time.
And then I have one more question. Students of dyslexia and those that need some mental health needs, how could we potentially make sure that we are meeting their needs as well? Because, unfortunately, I did read a study that we could potentially be seeing a large increase of students that are not being identified of having dyslexia because of either staying on virtual or not having enough instruction time. So I think that's something, of course, later on we're going to have to definitely look at, but is there a way that we can making sure that we're getting those kids the help they need as well now too, if we all go back to virtual?
Yeah, and I'll start, and then I see Cindy's on, so I'll turn it over with the mental health piece. But I can tell you that, we are continuing with interventions to the best of our ability with students with reading disabilities, whether those students have been diagnosed or early screened. There is now a new state screening tool that we identify students, must identify students at kindergarten and then we continue to keep those students in the loop through grade 1 and grade 2. So that is something that we are now required to do, and Stephanie Dale, who's our ELA content supervisor, is actually part of the development of that at the state level. So we've been doing well with that. I also want to let you know that our team has done significant work over the last couple of weeks in regards to our response to intervention. So we, to your point, Ms. Battaglia, how are we maintaining, looking at the progress of our students, identifying students early? We have recently, as you know, hired 7 early primary interventionists to make sure that we are focused on students at the earliest years to make sure that they do not slip through the cracks. That is brand new this year, so that's a huge win and a big positive for CCPS. But we also are looking at formalizing our response to intervention process where we will make sure that we continue to revisit those students that may have posed a flag, that we can continue to monitor the efficacy of the services that we're providing to ensure that we don't lose sight of those students or that we don't miss a student. There is no doubt in our current environment how difficult this is going to be as good as we were when we had kids every single day and all of them. But the reality is that we are not sitting back. We are actually continuing to do the best we can in a hybrid environment, or if we do decide to return to an enhanced virtual, those students will still be met with and monitored, if you will. But Cindy, I'll turn it over to you to talk more about the mental health piece.
Yes, our guidance counselors, our school psychologists, and our therapists are still providing services to our students. They're providing it in person and or virtual, depending on how the student is available. But all of those services have continued, and they've been very successful. We've been in touch with the families and students that we have a history of working with, as well as those who are struggling in the current environment with the pandemic and having a harder time with all the challenges that it produces. So we're getting to those students, and we continue to encourage families to communicate with the school if their children are struggling, so that we can provide the appropriate service that's needed. Also, to go back to the programs that we can offer, we are looking at career and technology at this point. The teachers at our Career and Tech Center are still there in person and are able to provide the in-person instruction that our and the hands-on instruction that our CNT students require. I spoke to Ms. Donovan today, and she is feeling really confident that program could continue. And then as far as Gateway Crossroads, at this point, we would like to be able to continue that program as well. The staffing looks like it's something we would be able to do. I will say that, as I'm speaking tonight, I'm speaking based on what we're seeing now. That could change as COVID cases go up in our community. But at this point, yes, we would be able to open those programs or to keep those programs going.
Thank you.
So board members, I think we might have gotten a little bit ahead of ourselves. I probably should have said that we go around the room and talk about the decision that needs to be made on hitting the pause button on hybrid for elementary, middle, and high school levels. And so I think there's a general feeling that, okay, we are outside of what the state guidelines are, and although schools haven't been the primary driver of new cases in the county, the current levels of community transmission and the protocols around contact tracing on symptoms have made staffing issues untenable at this point, and it's led to an inconsistent program that we're able to deliver to our students who actually are coming in person. And so I think with the recommendation that's on the table is that we would hit the pause button on hybrid for now for elementary, middle, and high, but with the understanding that we would try to keep as many things open as reasonably possible based on our conversations with staff. So are we but before we continue this discussion of what we can keep open, are we in consensus that that's what we need to do at this point in time? Or would anybody like to make arguments in one direction or the other before we go any further?
I'd like to say a few things, and many people didn't seem to understand. Last Wednesday, we were within the guidelines. Now we're not, and that's maybe a different situation. Some of my concerns, for whatever reason, last Wednesday, we kicked the sleeping dog, and the silent majority reared its head. With the cases where they are, I'm seeing 2-to-1 educators say, please keep me in the building. I'm seeing more than that, families say, please keep me in the building. I understand what it's doing to staff, and I understand all that. I look at our cases. It's so obvious that the kids are safer in school than in the community, and we've done zero. And Mr. Signer said that a couple times over a couple weeks, to increase the cases outside. And again, some of my friends in education hate me for it, but 10 miles from my house is a system open. And they actually closed an elementary school this week, had a dining hall situation at the middle school, but are still open. I just feel like we need to do everything we can for Carroll County Public School System and the kids to keep as much open as possible the whole time. And I think if we do this, if we make a decision tonight that we do back off, we need to evaluate it at least every other week, maybe more often than that. And I do not want to hear and see that something has to be 2.37 or we can't open back up. If we get into the guidelines that CDC says we can, we need to do it. And I'm disappointed for many of the students. It was working, and it was working because of staff and the teachers and the whatever. Kids were getting a lot out of this, and I'm very happy about that. And then lastly, if depending on what we say, Mr. Frazier, you brought up masks. Our numbers are so good in the schools. I'd be curious the concern about that, because I see masks maybe even being more problem with special needs kids, more problem with elementary, where we haven't had big issues. I don't feel like I want to tie our system's hands and say kids can do this, kids can't do that. We've been so successful. Our school buildings are safer than any building I go into any place. It's just amazing to me. And so I don't know how big of a concern that is, Dennis, but I'd be curious to hear, because I'd like to let that up to the professionals to decide how that should be handled. And if there's kids that have a legitimate reason not to wear a mask with us open hybrid top to bottom for 5 weeks, it hasn't been an issue, then I'm not sure we want to tie their hands on that. So
if I could respond, Mr. Kyler, I believe that where this Carroll County Public Schools has to close down some programs, they were LFI programs. And they were closed down, from what I heard, is because some students, for whatever reasons, can't wear a mask or aren't wearing a mask. And when you got to get close to to students to help them out, and you do, they should have to wear a mask. I
understand.
just think the masks are very important, especially in these specialized programs where you have to get close to the students because it's just part of teaching them. And if they're not wearing masks, or for whatever reason, they should not be allowed back in the school buildings. And I'd like to say just a couple other things about the recommendation. If we're going to reevaluate every 2 weeks, which is, I guess, the suggestion right now, although to be very frank, I think we should go virtual until after the winter break, but I'm not a voting member, so don't even think about that part. But if we're going to reevaluate every 2 weeks, we should reevaluate with the intention of going back to hybrid if it's possible, or possibly even closing the smaller programs if the numbers are getting worse. If you're going to reevaluate, you got to reevaluate on both sides, not just one.
And I agree. I think that's a good point, and I think hopefully we have. And the only thing, again, back to the mask, to me, that's if they really have a medical reason, I'm not sure we should or can discriminate against that. And again, I understand what you're saying, and it's hands-on, and you and I both do a sport that's hands-on, and they practice without mask, and I guess I'm just not as concerned would be the right word. But again, I'd rather see our professionals handle that with and noted that you're saying it's a concern, but I don't want to see us limit that. And again, and yes, if we're not going to evaluate very regularly and open up very quickly, then my vote tonight would be let's just stay open. I'm not willing to say something till January at this point. Cecil County did until December 7th. They picked a date, and I don't know what's better. They picked a date and said, we'll evaluate. And what you said, Dr. Lockhart, is by the 2nd, we'd reevaluate, and you didn't say the date. And either way, I'm okay with, but I'm not, and again, Commissioner Fraser, I agree with you. If things continue to spike, then we got to talk the other direction also. I think we reevaluate everything, but regularly.
Yeah, my recommendation, thank you, was, and then I want to get to Mr. Shockney here in a second, was to Wednesday the 2nd seemed like a logical place after the Thanksgiving holiday, because we would need to we can't just say, okay, tomorrow we're going to do this. We'd need to give some time. So I'm saying that gives us that span. We look at it, and I am of the mindset that we do not, I do not want to write off months and months in front of us. I want us to constantly be looking at it for the reason you said, Mr. Fraser, was both ways. If Ed Singer presents metrics in 2 weeks that are, hopefully not, but way worse than this, then we may need to look at the programs that we're running and what are the impacts there. Mr. Shockney, could you please talk a little bit about how we currently handle the mask wearing and the approach, mostly through MSDE guidance as well there?
Sure. And Mr. Stricker, you feel free to jump in on this, but I'll speak from the lens of our students with disabilities. So we anticipated that when we brought students back in, that there may be some students who may not be able to wear a cloth face covering or a mask for a few very specific reasons. For example, some students have very significant sensory needs. Some students with significant cognitive disabilities or other students with respiratory needs may not be able to wear masks. As we brought students in, we found out, though, it wasn't as widespread as what we thought the students would have challenges wearing masks. There are some students who cannot wear a mask for a very documented reason within the IEP. And in those instances, our staff are utilizing additional personal protective equipment or PPE. For example, our protocol is if we're working with a student who cannot wear a mask, that staff member is going to wear a face shield in addition to their cloth face covering. But we have some students that just have documented medical needs that would prohibit them from being able to wear a mask. And I would caution us on not making exclusionary rules for students if they couldn't wear a mask. This is in alignment with guidance from the CDC, from MSDE as well. And it's really more of an ADA issue than a special education issue. But again, we do have some students who cannot. And in those instances, we are taking additional steps through the use of additional PPE to protect staff in those instances.
And
The
Mr.
only
Kyler,
thing
I
to add
agreed
to
with
that, Mr.
everything that
Shockey,
you.
if-
Oh, I'm sorry.
Want me to
oh.
add one piece for all students beyond what Mr. Shockey shared with documented disabilities in the IEP process. We also have a mask exemption that our nurses work with students, and the family has to get the doctor to sign off, and we don't have many of those. I think the anticipated numbers exceeded what the reality is. Folks have been very accommodating, and our students have done a great job at wearing masks, and that's going very well. So I echo Mr. Shockey's sentiment on that, and do want to let you know we do have a protocol in place from a health services lens as it relates to the process we follow for a mask exemption.
And for our students who cannot wear masks, it's not just we're not working towards it. We'll work with the student if there's a sensory need to help build their capacity or their understanding of being able to wear a mask. So it's very much an instructional piece as well for those specific students where there's not the ability currently to do so.
And you guys, from my world, you got protocols for everything, but back to Mr. Frazier and a concern, if an educator has a concern because of that, is there a protocol? Who should they go to and say, I think I think little Johnny's abusing this role. Can we do something? Does that happen and on a regular basis?
I say if that were to happen, that would generally go through the health services lens. I mean, it might be Mr. Shockney's crew as well, but that's not an occurrence that we're seeing, Mr. Kyler.
Okay.
And in the instances, Mr. Kyler, when a student cannot wear a mask, we have a documented area of concern within the IEP. If at any point in time there wasn't, that would be a time where we would utilize that form Mr. Streecker had referenced.
Okay, thank you.
And Mr. Kyler, I agree with a lot of what you were saying earlier, if not most or all of it. There were maybe a couple of things that but certainly most of it. But I think this board has stood together resolute over the last couple of months, to support as much in-person learning as possible, because we truly believe in the value of the in-person learning. And just your point about a date for reevaluation, I think is well made. I mean, just as the state guidelines have indications of when we should be moving back to all virtual, there are also those guidelines there to open it back up to hybrid, right? So I think that we don't want to necessarily, there's going to be a bit of a lag between the numbers, us getting together, evaluating and opening up, and that might be precious time that's lost. And I think it worked well when we set the October 19th date for opening hybrid early on to basically say, this is what we're going to be preparing towards as long as the numbers are in the ranges that are acceptable. So maybe we want to take that approach again for a move back to hybrid and say, okay, once the numbers get back down into what state allows for hybrid in person, that we pull the trigger. We don't necessarily have to get together and evaluate it and beat it to death. We've put a lot of things in place. We've put the dashboards in place out there for complete transparency with the community, right? With cases that we're seeing in the schools, so maybe we take a similar approach and say, well, look, we plan to move back to hybrid, and now that would require the community to kind of be aware, right, of what's going on with the community metrics, and is there a way for us to do that? Like in much the same way that we have the dashboards now on the carrollk12.org website, where you say these are the cases that are in the schools. Is there a way for us to track something and say, look, we're gonna trigger this as soon as certain metrics are met?
Right. I think Mr. Singer's team produces this data every week anyway. I don't want to speak for you, Ed, but I think I see you saying something to that effect, that these are the key metrics we're kind of watching, especially the one with the state provides, the Maryland school metrics guidance. We would have that on a weekly basis. Is that right, Ed?
Yeah, We've been providing you, I think, over a period of time, weekly updates on this data. The other thing is I can, it's easy to send you. I think the key things that we're looking at here are the positivity rate and the cases per 100,000, and I could send those to Dr. Lockhart on a daily basis. I get those every day around 10 o'clock, and I can let him know what those numbers are each day.
And Commissioner Frazier, to your point, it would have to go the other way as well, right? Like
Yes.
if numbers deteriorated to another point, then we would consider closing up more of the whatever it is that we decide to keep open at this point.
And we've been meeting on Wednesdays, and so Mr. Singer, you've been giving us that on Wednesdays. Is that the best day for you to produce this whole handout? The daily information's great, but to do this, and I just think this is important enough. I don't care if we meet every Wednesday, every other Wednesday, or we see information and say, hey, let's meet this Wednesday. I think we need to meet and discuss. It's not quite as black and white as some of the world wants it to be, and both ways. And I think we need to include our dashboard in the evaluation. Again, if that becomes a staffing issue, a student issue, if we see flare-ups there that we haven't seen, that's a concern too. And again, I also think as good as our history has been in school, that's a plus the other way so far. And who knows, October 19th, we thought the world was going to get better. So who knows? It could get worse also.
And it did, but
yeah.
then it got worse again.
Yeah, I can't see an automatic trigger, and I understand with the community, but I think I think the way it is, we have to evaluate and pull the trigger either way as needed, as staff is going to do with some of these individual programs. You've made it very plain. You're not promising every one of these is every day, and you're not saying we might not do more if it starts to suit. Correct?
That's correct. And, as I look at the timeline moving out, I suggested us reconvening Wednesday after the budget work session. We also have a board meeting the following Wednesday. So
That's good.
we already have a couple of built-in checkpoints
Yes.
for that.
Right. So we would, it's not that, so I guess we need to understand how quickly we can re-pull the trigger, right? Like on the, with the community, how do we make sure that everybody is aware of exactly what's going on and when, right? So if we met on December 2nd to evaluate again, how quickly would we be planning to say, okay, turn it back on, if the numbers were in the right place?
Right. So I would want to see at least a little bit of a trend. Stuff can fluctuate one day and then pop back up. Right now, we're seeing a trend in the wrong direction.
Right.
So I don't want to wait, 2 months. Say we'll start in, whatever. But I'm not exactly sure in terms of turnaround. I'm suggesting a Wednesday because I think the very earliest, when we're talking about, just doubling back on who all's still coming to the sessions. I'm going to look to Cindy and John for these logistics. The transportation piece should be pretty solid. We'd need probably, if we made it, if we had some really good weeks of data and we got back into these zones where we've been operating in the hybrid previously, and we were able to make that decision on a Wednesday for potentially the following Monday, I'd want to give people at least notice.
Yes.
I look to the board for the reasonableness of that. I look to our staff for the reasonableness of that. I think that's probably the best kind of turnaround we can do.
I think that sounds super.
Yeah, I think that makes sense, and we know that we can do it because we've already done it, right? But yeah, I think from a Wednesday to a Monday is reasonable. Do others agree with that?
Again, I can appreciate hearing by a certain date, yes, we'll relook at the metrics and make decisions as needed. My concern is coming in, though, with consistency. I mean, we're asking people to turn it on again, turn it off again, let's be prepared for hybrid next week, but the week after, we're going to go back to all virtual. And I think it's creating some anxiety. I think my major concern here is, this is all just quite overwhelming. And again, as we've said, our numbers, our cases, by the time you look at the folks that have to be quarantined because of their contact with other folks, I just look at how it sort of overwhelms our school staff as far as our administrators. I'm just picturing the administrators daily, just trying to keep track of who can be in the building and who can't be in the building and filling the slots as needed. I know that the teachers have concerns because, and again, I can't say all, I should say that there are some, I'm sure, who have the concern that when we are in hybrid, I've heard some folks say they didn't know which kids were coming the next day. And, they would be expecting kids to maybe be home and going virtual, but they would show up the next day. And that too is a concern with all the back and forth. And, I just think it begins to take a toll on the entire program. And, I hear, again, how central office staff is impacted by covering classes and helping out. We're appreciative that you're doing it for us, but then again, it's overwhelming because then the jobs that they're not doing for us centrally, which are important jobs, they're covering classes. And again, even though that's essential at the time, somebody's job or jobs are not, their jobs just aren't getting done, and we're going to be paying the price for that, I think, down the road as well. So again, it's overwhelming when we look at the number of people who are being quarantined and the impact that that's having on our instructional program as far as our school staffs and our central office staffs. I can appreciate saying, yes, we are not ready to be in hybrid. I agree, we do need to pause the hybrid instruction at this time for all three of our levels. And I am open to looking at some of these limited programs that we might have in person. But I guess, again, I know that we don't want to shut down totally for an extreme long period of time, and I'm not recommending that either, because again, our job is to educate the students, and we want them in our buildings when the metrics say that it's safe for them to be there. But again, I guess I have the concern that I just don't want it to be a week by week or a 2-week situation, because again, I'm concerned about the consistency of the program, and I'll just leave it at that.
And I completely understand and agree where you're coming from, Dr. Dorsey. I think one of the things that comes out of that is we can't let up on the pushing at the state level to get some relief on the having to quarantine and contact trace on COVID-like symptoms.
That would be very helpful.
Because I think that's one of the major stressors on all of the staffing issues that we're having. So I think that that we can't let up on that, because that's a key component to, okay, if we get the relief on that, then it makes all of this a lot easier and takes one of those major stressors away. And I also will say, we did get a lot of emails from parents of high school students that saying, even though it was just, 2 days for in-person, those 2 days meant a lot to them and actually went a long way. We got a lot of emails from parents thanking us, saying that their kids' attitude changed dramatically, that they feel like they now have a much better understanding, like just having that 2 days of contact with of in-person contact with their teacher made that much of a difference for them. So that's why I understand we want to be able to deliver a consistent program, and it's very important to a lot of these students. But I think that the main thing that we need to keep pressure on is that issue at the state level.
And I think Dr. Dorsey's point is why we need to, when you had said, could we do something to just trigger it, it's why we need to meet, because I think it depends on, I think it's great to know that you feel comfortable if we say on a Wednesday, it can happen by Monday, but depending on which Wednesday it is, we may say, wow, you know,
If
the
it's a
numbers
short
are
week.
so-so, but maybe we don't want to do it this week. Maybe maybe it's right to wait another week. So I think that's why we need to meet and discuss, knowing the possibilities.
Can't just have it be an automatic.
Yeah,
trigger,
yeah,
right?
I understand your concerns.
Well, I will say one thing, and I've got to say it. I will fight to the end to keep career and tech open. They need hands-on experience, and you can't weld looking at a TV or a monitor, and you can't cut hair on a rubber baby doll's head. So, we need to keep that open. They were really shortchanged last year in the spring, and those juniors are now seniors, and they need to be in there and complete their courses. So I will fight for that to the end. That they have got to, that group has to go any way possible so that they can get their hours in and that experience in.
And I certainly agree with that. I thought for now, though, we were talking about just the
Yeah,
whole hybrid
no, I'm just
instruction
talking
piece,
about.
Pause on the hybrid.
When we
Right.
pause, period. But
Right.
I just want to make sure that,
that we don't lose sight of getting
yes,
career
that
and
we don't
tech.
lose sight of those students.
Okay.
And I absolutely agree with that, Ms. Herbert. I really do. It is important to make sure those students have that. And as Dr. Dorsey said too, we need to look at everything, make sure that, it is looking like it's going down, and if there is a little uptick, okay, we got to look at that and see where it came from. But if there's a massive uptick, okay, well, obviously we know we got to do something. But if it's coming down, it's maintaining down, we just need to watch everything. And I think the one message we need to send the community too is, we need help with this. We need community help to get the numbers down. And so I think that's one of the messages we need to send out, and parents need to send out, the parents that want their kids back in the schools, they need to send that message too, like, hey, help us out so our kids can get back into school. It's, it is a very difficult situation. It's very hard for everyone. The county is now where we haven't been before, and in order to bring the numbers down, we need the help in the community. So we're going to have to be the leaders in this part. Yes, it's not easy, and yes, we know that kids do belong in a classroom. No one has ever argued that. But it's just making sure that this is done to prevent any more disruption from happening. So we need help with this.
And the one last question I have, as part of your proposal, do we need to discuss sports? Are they still doing skills and drills, and they're still set to start December 7th? Is that a separate conversation or a conversation for next meeting, or is that part of this discussion?
So Cindy chime in. I know she has Mr. Duffy on standby.
Oh, okay.
Yeah, we can discuss it at this meeting. I know we do still need to discuss the eligibility requirements that we talked about at the last meeting. So we can discuss where athletics stands as a part of that discussion on eligibility.
Okay, thanks.
Makes sense.
Okay, so we. Oh, go ahead.
I'm sorry. A question on what Mr. Collier was just saying. Are you suggesting that we still have practices, skills, and drills and all for students when we're not even going to have hybrid? Is that what you're suggesting, or you're saying we're going to postpone that? Because I would think if we're not going to have students in school for hybrid learning, skills and drills and anything else for sports for high schools would be stopped as well. Because I don't understand the reasoning behind not doing that.
I think we need to talk about that later.
Discussion.
I think we should, I believe we do need to have additional discussion on that. Maybe we can table that till a little bit later in the discussion. Does it make sense at this point to make a motion and take a vote on pausing hybrid, and then we can talk about separately what are the programs that we want to continue, and take a separate vote on that piece of it?
Okay, I would agree with that. And again, let's be specific. As we pause hybrid, we're really saying we want to go to the enhanced virtual model. in place for elementary, middle, and high schools.
Okay, and do we have and this would be effective as of tomorrow, correct? I mean, we signaled to the community that this was that was one of the reasons, last week that we said, okay, we're still within the state guidelines, so we're going to continue on, right? But we said specifically we were going to signal to the community to start preparing for this, right? So
Gave
this
them the heads up that it would be effective.
exactly. So this would, are we in agreement that it would be effective as of tomorrow?
That's your proposal, correct?
That is my proposal. I do need everybody to understand that we are shifting from one model to another. And so there will be a little bit of a transition there. And so I know people got accustomed to what the full virtual looked like after a few weeks in, and it was getting fine-tuned. There'll be a shift back to that. And so I just need everybody's patience as we shift back to that. That there'll be some work on the schedules. There'll be some work on getting everybody back into that routine. So it might. I'm not expecting perfection tomorrow, but there will be an adjustment period.
Dr. Locker, let me make it a two-part question just to make sure everybody understands. Your proposal is they not attend as hybrid tomorrow.
Correct.
But what you're saying is with a 8-hour transition, tomorrow will be iffy, and I think everybody recognizes that. But
Right.
but they're not going physically to school tomorrow.
That's correct.
Now,
We did signal that last week and tried
Yes.
to make sure everybody knew that was a real possibility.
yes.
And that is, of course, except the groups that we're about to discuss
Yes.
now, right?
Correct.
So,
They will function tomorrow.
Yes.
okay. So so I will make a motion that we are hitting the pause button on the hybrid model for elementary, middle, and high school effective tomorrow. We will have additional discussion after this vote as to what programs we can keep in place. And we will be meeting on December 2nd to review the metrics, which will include Mr. Singer's dashboard as well as our own, in order to determine whether we are in a position to restart hybrid or not at that time, or potentially move in the other direction should metrics continue to worsen.
And I'll just remind everybody, we won't have the same data dashboard because we won't have the data for in-person. Do you know what I'm saying?
Yes.
So just as a reminder, okay.
And thank you for that clarification. Do you have anything to add? Do I have a second for that motion?
I'll second it.
Okay, seconded by Dr. Dorsey. Board members, now any additional discussion or anything that I missed or needed to be added as part of that motion? No? Okay, then I will call for the vote. All those in favor, can I get a verbal aye, please?
Aye.
Any opposed? Okay, that passes unanimously. Thank you. Okay, so now let's move on to the discussion of which programs we believe we can keep going at this time.
Definitely career and tech.
Okay, so we've already discussed a bit of career and tech. And
Crossroads.
staff has basically said that we think that based on current experience and current staffing levels at career and tech, that we think that we can keep that program moving. Everybody agree on that? Okay. And then Gateway and Crossroads?
Yes.
Dr. Locker, did you want to add any comments
No,
about?
I'm just looking to staff for any logistical issues, or I see Cindy giving a thumbs up, career tech, Gateway.
Dr. Locker,
Yes, John?
from an operation lens, we certainly don't object to any program being open. The one logistical thing that would need to be worked out would be transportation being arranged for all these programs. I don't think it would be difficult to turn on career and tech literally tomorrow. I think that exists set up and ready to go again. I'd look to Mr. Shockney and Mr. Hardesty if Mike is also on to talk about whether or not each and every one of those special ed programs that's been discussed, transportation could start tomorrow. That might be a more of a scenario where transportation might have to start in a couple of days. And it doesn't mean that the program couldn't convert tomorrow. And for those students who have transportation, they would be there. But as far as having bus routes set up for everything, I'm not real sure where we would stand with each of those. Nick or Mike?
Yeah, I'm here. Good evening, board members. We are prepared to do career and tech tomorrow. We have talked to Ms. Donovan and have everything in place that we had in place prior to starting hybrid. However, the other small groups, we are going to have to regroup with Mr. Shockney and other administrators to make sure that we have the correct kids and we have the bus routes set up. I'm pretty certain we could certainly start that by Monday, though.
And or just a point of clarification, if we're assuming that we're still going to continue the specialized programs utilizing a hybrid model, so an A cohort and a B cohort. That's how we've been functioning currently. So tomorrow, in a sense, as a B cohort, our students are already attending our specialized programs through that cohort model. So if that's where the board wants to go, we could continue following the same patterns that we've currently been doing for our specialized programs.
And Mr. Shockney, can we just clarify that that you had mentioned BEST, PrEP,
Sure.
LFI, and
yeah.
Carroll Springs?
Yeah, the sixth would be the autism program, including the BELLS program. That's the preschool program. Right. The BEST program, Carroll Springs, the post-secondary program, which is also out of Carroll Springs.
Right.
The PrEP program, which is our preschool program at the 5 elementary sites, and then our Learning for Independence programs. Okay. Those would be the 6.
Okay. And you're saying that those could continue tomorrow, or that would need to be redone on, or to start on Monday?
I'll defer to Mr. Hardesty on that, but we've had the students who are participating in this program have been attending for some time now. So in a sense, it would be a continuation of the model for our students, our special programs. But I'll most definitely defer to Mr. Hardesty. And
they're not changing, so
we need to collaborate a little bit just to make sure we've got all bases covered. That's perfectly fine by me.
Well, we might have an issue with the BEST and the Gateway students riding the same buses, but I think Mr. Shockney and I can talk about that tomorrow and work through any potential issues. We'll be prepared to start as soon as we possibly can.
So I guess what are we saying? We know we could hold the program tomorrow, but I need to know specifically about transportation tomorrow.
We have not had any conversations with our bus contractors about restarting. We had in place prior to starting the hybrid. Anything that's running independent of hybrid will certainly go on tomorrow. But I'm not certain about the combination of BEST and Gateway at this point. I'd have to check on that.
Okay, so I'm hearing you say you need it, so it might be more ideal to pick up get the logistics squared away for those specialized programs so that transportation would begin Monday. Is that correct?
Yes, I'm certain we can get things going by Monday, yes.
And Mr. Hardesty, from my lens, it's good. We're not going to be adding any students. It's the same students that we've been working through on the cohorts, just be a continuation.
Mike, could you explain why that's different? I think I understand that prior to elementary and middle hybrid starting, it was its own sort of specialized run. And then once we started the elementary and middle school hybrid, that combined some students on buses. And now we're looking at going back to what we did pre-hybrid. Is that correct?
Yes, there's a totally different arrangement and grouping of students especially once we started the high school runs. So we just need to go back and make sure that all the contractors and bus drivers that were doing those runs are clear on what they're going to be doing again. So.
Okay, so we're saying that we could do, for tomorrow, we could do prep, Carroll Springs and post-secondary, LFI, autism, and bells. And then on Monday, we would be able to add best and gateway. Did I capture that correctly?
From a transportation standpoint, yes.
Okay. Was that a yes, Mike, from a transportation standpoint?
Yes.
Okay. And so, Nick, we'd need some communication then about the transportation issues for those programs impacted tomorrow and Friday.
I'll communicate with families tonight, Dr. Lockhart.
Thank you.
Can I go back to career and tech for 1 second? I'd like to know how many students are in the building at one time on the way it's being run right now, because the numbers are so high. And I know it's very essential they have hands-on and all that, and I understand that, but is it safe? What are the number of students that are going in career and tech right now?
Or the Carroll County Commissioner's opinion.
I don't know if Mr. Eccles is on.
I don't believe Mr. Eccles is on.
Okay.
Commissioner Frazier, the number of around 200 some students on a given day is sticking with me right now. I can go ahead and try to retrieve that number for you in the next couple minutes to give you an accurate, more solidified number, but it's around that.
Okay, well,
everything.
So before COVID and everything else, what was the number of students that was in that building on a regular day?
Yeah, so as Ms. Herbert indicated, we started on a scaled model. So we had only so many programs in there for a few weeks, and then we added more programs, and then we added more programs. So the number we got to was about 200, and I don't know the actual number, but it's 200 and some. So what I'll do is I'll get that number for you. Everything that we've heard from, and Eric or Cindy can correct me on this, everything we heard from the principal who's running the building right now feels very confident that we can keep that a safe environment based on the model, the hybrid model that we're using right now. Cindy, I don't know if you wanted to add anything to that.
Well, if I go before Cindy there, if you don't mind, I understand what you're saying, and I appreciate what you're saying, but my question is, basically, how many students normally go to that building? This is before, like last year, before March, how many students are in there every day?
Right. I can answer that. It's
Right now.
approximately 750 to 775 in a normal split sort of day program.
Right. So we have about a third of the students going in right now, somewhere around there.
Right.
That's what we're looking at. Okay. Thank you.
Yeah.
And I think to answer your original question, Commissioner Frazier, was, is it safe? And I think that, staff has definitely tried to address that, and we see it in the dashboard, right, that there have been very few cases. So Career and Tech has been open since the very beginning, right? And there have been very few cases in there, and staff has opined on the fact that they believe it is safe and that they can keep it running.
Yeah, and I'll just reinforce that. The advantages they have there are the big shops, the availability to keep garage doors, outside air coming in, and the protective equipment those programs required before COVID, and the fact that programs don't rarely interact with kids from other programs. So there are so many things that are built in as advantages of Career and Tech that have kept them, certainly our cleanest, safest school environment at the high school level.
Okay, so we've addressed Career and Tech. We've addressed the special programs. I know that we've talked about Gateway and Crossroads. One of the other things that we had mentioned was pods at the high school level and kids that are struggling with connectivity that we're bringing in. So do we want to address that next?
Yeah, we can address that. I'll defer to Mr. King to talk about the pods. I know they've been very successful so far. and they've been staffed with either teachers or instructional assistants who provide supervision during that time. So, Mr. King, how do the principals feel about being able to keep the pods open with staff coming in person?
Yeah, thank you. The texts have been coming in from my principals with a couple different details. So some of the schools may only be able to offer a pod tomorrow for the connectivity kids as they get their staffing reorganized for an actual instructional pod that have traditionally been held in the media center. They are all willing and able to get the pods up and running, but a few may need until Monday. So that's sort of the dynamic there, because obviously when the kids started to come in for hybrid, the pod didn't exist. So an affirmative on getting them all up and running by Monday. I haven't heard back from all of them as we're sort of texting back and forth. But I know, like Keith said, we will get our pod kids in tomorrow. But the whole pods, I mean, the connectivity kids, the two that I think have been coming in for weeks, but then they will need a few days to get organized for the full pod, which was up to 25 kids at some of the high schools.
Okay, so Mr. King, I'm just trying to understand. So we're saying we can get the pods kids in tomorrow?
It's going to be probably limited at the schools, as they have to get the staff that were working the pods before we went to hybrid to confirm. But the desire is there, and they're all confident that they can get the pods up and running quickly.
Okay, so have those families been directly contacted so that they know the situation of whether their kids are going tomorrow or Monday?
So once we got back to the hybrid, Mr. King, a lot of those pods didn't exist because the kids were coming to school.
Kids came in hybrid. So I would say, President Savigny, at this point, probably most parents at this point assume they will not be able to come in a pod tomorrow. And any pod offering tomorrow and Friday will probably be looked on as a bonus. But by Monday, I think we can have our full pod system up and running.
Okay, so the full pod system will be up and running on Monday.
We just need a few days to reorganize ourselves.
Right. Understood.
Thank you.
Understood. Okay. And then we also wanted to talk about tutoring and other intervention capabilities.
The academic support and recovery.
So I don't mind starting. I do know that we have plans. Obviously, there is virtual tutoring that is taking place right now. By its nature, it's after school hours. So obviously, it would be taking place after the enhanced virtual day is completed. And teachers have been assigned to students to make that happen. I believe the directors could probably speak more specifically to any face-to-face planned tutoring that may have to move now to an enhanced environment for the next couple weeks. But as far as the plans have indicated, there's a significant amount of tutoring taking place virtual right now. I don't see any reason why we wouldn't continue to do that in an enhanced virtual scenario after the school hours.
Jason, you're correct. Any of the schools that started to have in-person tutoring have made plans to scale that back and to do virtual tutoring as well. Since transportation wasn't provided, most of the students that they were meeting with after hours, they were going to meet with virtually at the elementary level anyway, based on the needs, and they arranged times for those supports already based on their plans that they submitted last month.
And it's the same at the middle school. We have the academic recovery and the tutoring planned, and we'll just make adjustments based on which model we're in and what student needs are. So they can all move forward.
Yeah, agree. The tutoring has been going on after school hours anyway, so it should continue pretty much the same.
Okay, and Ms. Battaglia, I think you also brought up ESOL. And did we have a plan or any additional comments that we wanted to make about how we were handling ESOL students going forward?
Well, I can speak specifically to how we handled it within the enhanced model as we began the school year. As I mentioned earlier this evening, our ESOL teachers are not only providing ongoing enhanced virtual service, they are also doing tens of home visits on a regular basis, connecting with families at their home. It's quite remarkable the amount of time they're putting in and miles they're putting in, driving all over the county, and actually targeting in the most positive way our ESOL families to make sure they are getting what they need beyond academic support, but also, as I mentioned earlier, with interpretation and any type of translation that's necessary. So I'm confident that Ms. Mesta and Ms. Burns will be able to continue to collaborate and make sure our services continue.
All right, board members and Dr. Locker, did we miss anything? Was there anything else that, oh, wait, I did have one more. Teachers teaching from the buildings. We would not be requiring it under this scenario, but we want to make sure that the teachers who want to continue teaching from the buildings have that ability.
Yes, I think it's important.
Okay, because we did receive a lot of emails from teachers saying that teaching from the building was working really well for them. They don't necessarily have great connectivity at home. And I want to make sure that they still have that ability. Does everybody agree with that?
Absolutely.
Yes, because again, we're saying that those who prefer teaching from home, from their home offices, certainly have that flexibility as well.
Just make sure they're following the protocols.
Thank you for that. President Spigney, Mr. O'Neill, did you have one more transportation follow-up?
Yes, sir. Thank you. And I apologize for jumping back. We wanted to talk a little bit more about Gateway and Best. And if you'll indulge us, we're sort of reacting to the conversation as it's unfolding. But if Mr. Hardesty's still out there, I'd like him to come back in as well. Mike's been talking to his crack staff as this conversation has evolved, and we do think the way the buses are aligned and paired, we would be able to continue immediately with Gateway and Best. Is that correct, Mike? You're confirming that?
Yes, we can, provided it's the same grouping of students that we had been doing. So that might have been my misunderstanding. As long as it's the same organization and grouping, we can resume that tomorrow.
Good.
Great.
That's fantastic, Mr. Hardesty. Thank you.
Great.
We appreciate Mr. Shockney for pointing out that we're staying in the AABB cohort, so we're good to roll. Sorry for the confusion. Thank you.
No, glad we talked about it.
Absolutely. All right, I'm glad you guys are talking amongst yourselves behind
Yes.
Okay. All right, so board members, any other items or groups?
Well, with all of these groups in total, approximately how many students will be taking part in these in-person instruction during the enhanced virtual model?
That's a great question. I haven't done the back of the envelope math yet, so I might need a few minutes to give you an accurate. You're asking for the total number of students in all these small groups?
Yeah.
Devanshi? Okay, give me a few minutes and I'll cobble something together for you, knowing that it might not be exact.
Thank you.
I think tonight, everybody on here and Dr. Lockhart, you've shown flexibility.
We're trying.
Now, with this occurring, when we have heard from several families that virtual was not working for their child, they were having a lot of difficulties. Should those parents reach out to the principal or anyone to find out about potential, bubbles that they could be at in the schools or anything like that, or tutoring, or I just want to make sure parents know that they still need to, reach out to somebody to see about getting some help.
Yeah, absolutely. At the elementary level, reach out to your teacher. Middle and high, where you're traveling to different teachers for different classes. Either and Tom can jump in here, either the administration or a teacher that you established a relationship to seek out that support or that help. We want to hear from folks if they're struggling or there's a concern or there's an issue, because that's how we can best address it. So yes, please call your child's teacher and or the school administrator, counselor, or other trusted adult at the school where there's a relationship that they know, here's how we can help you.
Yes, and thanks for bringing that up, Mrs. Battaglia, because some folks certainly have indicated that the virtual really wasn't working well for their children. So again, we just don't have a one-size-fits-all with everything here. So again, certainly we encourage you to reach out and get some support for your children.
I would say there definitely was a common theme to a lot of the emails that we were receiving from the parents saying that their students were struggling with virtual, that they were, typical like straight A's or A and B level students, and all of a sudden they're struggling. They're getting D's or F's in several, if not most of their classes. And so those are the kinds of situations where we're saying, okay, please reach out to your administrator to try to set up these additional tutoring opportunities, interventions, things like that. And I think that as we receive those, as those kinds of emails come into all of our mailboxes, if we could reinforce that with those parents, like, please, like, we are trying to help you. We have some resources to help you, so please reach out to your administrator, and they will work with you.
Yep. Thank you.
Dr. Lockhart, I'd just like to seek some clarity for a staffing perspective. So of these programs, I know there's a lot of folks out there right now wondering, of these programs that we are anticipating to continue, staff would then expect to continue in the hybrid model in our specialized programs in our CTC. Okay,
That's correct. That's under the limited programming model according to the state's model. Yes,
Okay.
and as we've said all along, we're going to continue to monitor the metrics. We're going to continue to monitor situations at our now limited programs, and we'll have to make changes as we've done in some of the small programs throughout the county as situations arise. Devanshi, back to your question, was it on any given day, or was it how many total students are we bringing back in the limited programs?
Total in the limited program.
Total is approximately 750. Okay, that includes Career Tech, Gateway Crossroads, and the specialized programs that we've mentioned.
Great. Yeah, that's thank you for that statistic. It's good to take in context to the other amount of students that we have. And just another question. So many schools conducted an asynchronous Wednesday today for the first time. So will that still be an option going into the enhanced virtual model?
Well, I'll start, and then our staff can jump in. We want to provide some flexibility on Wednesdays for both our students and our teachers, because we recognize, just the conversation we've been having in the last 5 minutes, there are a lot of challenges associated with whether we're in hybrid or whether we're in all virtual. There's a lot of needs, there's a lot of supports that are necessary, and we see that we hear from students and parents a lot that their children are sometimes overwhelmed with the volume of work. We hear from teachers about the challenges. Our teachers are doing an incredible job attempting to manage all this and this shift, and please know that it does not go unnoticed or unappreciated by me, that what we're asking people to do, to Dr. Dorsey's earlier point about sort of shifting. We tried to forecast or anticipate this for folks, so it wasn't necessarily, we're finding out about this the night before. We tried to signal it last week. But for Wednesdays, back to that, we want that flexibility there for our teachers and our students. I don't believe it should be completely asynchronous. In other words, there are a lot of folks who need some individual support that they could reach out to a teacher and get on and have the small group, or some of the tutoring sessions that we've talked about can be a check-in time. But we also know for our students' needs that it also can be a time to catch up on some things as well. So I will say to you, we want to still have a flexible lens on Wednesdays, but not completely asynchronous.
And Dr. Lockhart or maybe Mr. Anderson, do we have a target for, the students that we are able to provide tutoring and intervention services to? So we said that, we're expecting about 750 to continue to be in person in the limited programs, right? But do we, we've talked about tutoring and interventions kind of at a high level, but do we have an understanding of how many students we are actually reaching with those services?
Yeah, we do, President Savigny. In fact, we have it. The way that we looked at supporting schools was based on a per pupil allocation, and so I worked directly with the school directors to identify the funds, first of all, that each school would be getting, so we could do that equitably. And then the school directors worked with principals to identify the specific students within each building that would be receiving the additional academic support. So it would really be reliant and determined upon each individual building at the elementary, middle, and high school. And I would leave it to the elementary directors to give you approximate numbers that are being served in each building at each level. But we purposely were looking to disseminate the CARES funds by student at each building, so everyone got an equal part of or an appropriate fraction of the amount of money that we received as a system. So I don't know if the school directors wanted to share about potential numbers that they're seeing at each building.
At the elementary level, each program does look a little different based on the needs that they were seeing. Some schools are targeting primary students. Some schools are targeting, students in the intermediate levels, as well as, there are various levels of teachers who are taking part in this. As with Title I or any funding, it depends based on the programs that are currently overlapping, such as AEL. You have, your targeted poverty supports, as well as you have your Title I schools have Title I. So, I would venture anywhere between 20 and 50, per school are being served based on the needs and the overlapping programs that are supporting it.
Okay, 20 to 50 per school of the 22 elementary schools.
Correct. I'm speaking just at the elementary level. Correct.
Okay.
Mm-hmm.
Okay.
And at the middle school level, we've got a little bit larger numbers on the academic recovery side. It does vary from school to school, but our main target are students and their academic needs based on their coursework and based on their ability to meet the needs of the course in the virtual and now in the hybrid and back to the virtual environment. So it's been a challenge for the students. I won't kid you. We have an increased number of students that are struggling with their grades at this time. So each school has put together a program based on their staff and based on their student needs, but it's very targeted to individual student needs based on their academic performance.
Mr. Hill, do you have an idea of how many students that is per middle school?
It can vary from as few as 30 at schools where kids are being successful to upwards to 70 and 80 at some of the schools where we have more students who are struggling.
Okay.
And I would echo what the other two directors said, and our numbers vary as well. I mean, obviously, we have school like Westminster High School, 1,500 student enrollment, and schools as low as 900. Under 900 at Francis Scott Key. So the numbers sort of vary based on the enrollment of the schools and the amount of kids that are in need. But I know some of the deeper data I've received at Westminster High School, well over 100 kids have participated in different types of the tutoring and different assistance. So they are reaching out. And if anything, one of the bigger problems is students that aren't willing to participate. But if the students are willing to participate, going back to what many of you said, I can promise you they're pulling them into one of these academic offerings to help assist to improve their grades.
Okay. That's very helpful. Thank you. All right. So, amidst all of this, I mean, these are tough discussions, but I think we're we're getting through it. And but before we make a motion or take a vote, I do want to thank Dr. Lockard, all of your staff, all of our teachers, all of our educators. They have just done, they have put in Herculean efforts to pull this off. And I can't say thank you enough to all of you for all the work that you've done and how you've tried to support our students during this time. I think that we've done a better job than any other county in the state of Maryland, and I'm so proud of this school system. And I just want to say thank you from the bottom of my heart. And we'll just keep trying to make these decisions in the best way that we can, and learn as we go and adjust as we go, as life's interesting cards are dealt to us. But thank you.
We appreciate that. The folks out on the line here supporting our schools, and then obviously the people in the schools making it happen. We've all had to learn to adjust. It's not easy. I feel for every single one of our students and families every day, because none of us like this. So Mr. Singer, I don't know if you're still around, but I'll volunteer both of my arms for whenever that vaccine rolls around, and and let's get it going, because we want to be back.
Right. And after saying thank you to the staff and the educators, I also want to say thank you to our parents and our community. I hope that you can see that we're trying to do our best by the students. We understand that this is a difficult time. And, virtual is working for some students. It's not working for others. And we really are trying to come up with solutions that will benefit all of our students. Unfortunately, we have to take this pause right now on the hybrid model because of the levels of community transmission. Again, the transmission is not happening at the schools, but it's just the sheer level of community transmission that is going on that just makes it logistically so tough.
As well as the guidance we've been given about where we can operate and how we can operate. So
Correct. We are following the state guidelines, and we will continue to watch those metrics. And again, we'll be having the next meeting on December 2nd to reevaluate.
And we do need the community members of Carroll County to help us to get our kids back in the schools. We need their help. Everyone work together. No large gatherings, wear your mask, do what you're supposed to do your social distancing, so we can get our kids back. If the numbers go down, we can get our kids back, but we've got to do it as a community. We need everyone's help. Parents, advocate that too. That's one thing parents can do, is advocate, hey, please help get the kids back into schools. And that's what we really need. We need community guidance and help on that.
And we do definitely want to keep the push on at the state level to get relief on the contact tracing and quarantining of persons under investigation, or COVID-like symptoms. We definitely need to get some relief on that as well moving forward.
Yeah, and if I can say one thing quickly, and I'm cheating a little bit off of Dr. Dorsey because she said this earlier. This is an emotional time. None of us wanted COVID. It's here. I think we're going to come out of it stronger than we were before, I hope. What concerns me, I'm sure right now we collectively are getting emails that we're either the dumbest people that walk the earth or thank you very much. But please, guys, try to heal the divide. It's not with us. I'm not worried about us. I'm worried about parents and teachers and teachers and teachers. We're all working together, and we wouldn't have done, like Ms. Savigny said, we wouldn't have done what we've done so far this fall without everybody on the team. and it serves no purpose for us to come out of it with a great divide that doesn't heal for the next 2 years. That might be worse than COVID.
Well said, Mr. Kyler. Okay, so with that, Dr. Lockhart, I was kind of keeping notes as we went, but do you want to make the recommendation of the list of things that we said, and then we can make a motion and take a vote off of that? And I'll follow up if I have anything differing in my notes.
Okay, so the recommendation was, we're on the limited group programs, Career Tech, Gateway, Crossroads, the special education programs, the 6 that Nick mentioned, and I'm sorry, I didn't write them all down.
I think I can get it. So we've got BEST, Prep, Carroll Springs and Post-Secondary, LFI, and Autism and Bells.
Right.
Okay.
Correct, Nick? Correct, Jason? Okay, good. We also included the pods as well as the tutoring programs that are already underway.
Okay. I think that was all of it. We had said that all of those programs will be running tomorrow, with the exception of the pods. The pods will be Monday.
Right.
And,
correct.
And like everything else we've talked about tonight, you'll continue to evaluate, you'll add and delete as required and necessary.
That's correct.
And teachers do have the flexibility to teach from the buildings if that is their desire.
Yep.
If they're virtual, and of course there will be some staff that will have to be in the building because they're teaching these groups we just talked about.
Okay, and I will make that motion based on the recommendation that Dr. Lockhart just laid out.
Second.
Seconded by Ms. Battaglia. Board members, any other comments or questions before we take the vote on this? No? All right, then all those in favor, can I get a verbal aye, please? Aye. Any opposed? That passes unanimously. Thank you, everyone, for the efforts and the discussion and your ability to answer our questions very quickly.
Mr. Singer, you still on? It shows that he is but mute, but at any rate, thank you.
I'm trying to unmute myself. I'm here.
Hey, thanks a bunch, and I think Dr. Lockhart said you're going to give him a vaccine when it gets in, and thank you. Maybe you can give each other. I don't know. Thank you.
Yeah, I get to give it to him personally. I asked the sheriff when we were doing the flu vaccines if he'd let me give him a needle, but he kind of objected to that. I think he's a little bit wimpy.
Or he just doesn't trust you.
Poor Sheriff Louise. That's not nice.
He shouldn't. My nurses are very good at what they do and do a great job, and I have to give them kudos for all that they're doing during this pandemic.
Thank you, Mr. Singer. All right, so Dr. Lockhart, anything else under COVID-19 updates?
No, I think it's an appropriate time to move into the conversation around athletics. We obviously came up with something in this conversation that we needed to do, but also last time we had talked about revised academic eligibility requirements, and Ms. McCabe took some suggestions from you and brought back a draft, another draft. We didn't officially vote on that the last time. So, Ms. McCabe, do you want to explain, just a reminder, what we did last time and what you're bringing back tonight?
Sure. So last time we talked about extracurricular academic eligibility, and we talked about the academic portion, which was basically that there would be no academic eligibility for the winter season, but that starting with the second quarter report card, which is distributed on February 9th, that would determine academic eligibility for fall and then spring, going into spring, extracurricular activities. And that the academic requirements would be that the student maintains a 2.0 grade point average, which is a C, and have no failing grades, or Fs. At that time, we also discussed attendance. We had said that we wouldn't be looking at daily attendance to determine who could participate in activities on a particular day. However, we all felt that it was important that attendance was taken into consideration. So on the piece you have in front of you, you'll see some bolded text, and that's the text I added based on your recommendations from last time. So it starts with, however, regular attendance is crucial to academic success and is an expectation for all students. Therefore, beginning with the start of academic eligibility on February 9th, students' attendance will be an added consideration for eligibility. Students must be present 9 out of every 10 days. Specifically, so if you take a month, weeks A, B, C, and D, every 2 weeks, students must be present 9 out of the 10 days in AB weeks and 9 out of 10 days in CD weeks. So in that way, we would be holding students responsible for regular attendance. And I'll take any feedback on that you may have.
And Ms. McCabe, present could be either they're there in a hybrid model or they have checked in under the virtual model.
Yes, that's correct.
Okay.
Have there been issues with tracking this so far, or is that, I know early on, I heard a lot of kids thought they turned something in, didn't, they thought they were present a certain day and weren't. Have a lot of those kinks worked out?
Yes, we've worked a lot of those kinks out, we worked them out pretty quickly in elementary and middle, and now we're kind of at the end of working those kinks out of high school because they started back a little bit later. So, but yes, we're working through those.
Board members, any comments on that addition or anything about the eligibility recommendation in general? I like it. I think it makes sense.
This is what we told them, so
Right.
it's verbatim.
Right.
So I don't think there's much discussion.
And just to add, even though everyone will be eligible for the winter sports, our coaches will still be highly encouraged to follow the same process they always have, which is to stay on their players, to look at their grades, to review them. Some coaches will have kids walking into practice and they'll be pulling them aside if there's a problem in a class. So we're going to do everything else as if they had to be eligible, but we are just giving them sort of the free pass because of the circumstances to begin to, try out and participate in their winter sports. But the expectation with the kids will still be, we really expect you to take your academics seriously, and this is supposed to be co-curricular, and athletics and academics should work together.
Yep.
So, board members, then I need a motion for the approval of the revised extracurricular academic eligibility requirements.
So moved.
Moved by Ms. Battaglia,
Second.
seconded by Mr. Kyler. Okay, any other comments or questions?
I'll just add, board members, this is temporary for this academic year.
Correct. Does the recommendation need to say that
It
this
says
is?
it in the first paragraph, changes are intended to be temporary
Yep,
and
that's
specific to
specific. Yep.
school life during COVID.
You are correct. Okay, Then, board members, I will call for the vote. All those in favor, can I get a verbal aye, please?
Aye.
Any opposed? Okay, that passes unanimously. And now I think it probably makes sense to go a little bit deeper into the sports conversation and how it impacts or gets impacted by the December 7th date.
Yes, and we have Mr. Duffy with us tonight, who is ready to talk about what the plans could look like. Mr. Duffy?
Thank you, Ms. McCabe. Good evening, board members. Good to see you once more. We seem to be spending a lot of time together. What we're thinking is our plan now is, having spoken to the athletic directors, we will be suspending our spring return to play activities that are currently taking place outside. Our plan is to suspend them at Thanksgiving time. So next Wednesday, we will cease all athletic activities at that point. We also are making a recommendation. We believe it's in the best interest of the students to delay the start of winter sports from December 7th to December 14th. And the reason I say that is because that gives us a full 2-week period between Thanksgiving, while every government official and every health provider and healthcare expert says people should not have large gatherings, there's a good chance that several people will. So I think we need to act accordingly and give a full 2-week period from that time until we begin sports. It is our hope that through a lot of encouragement, as several of you have said, specifically Ms. Battaglia, over and over, and I appreciate that, that we're asking people to be responsible and do the right thing. That it is our hope during that during that 2-week period, if people will stay within their own bubbles, quarantine, that we will be able to begin winter sports in December. And hopeful that people are responsible will be able to do that. But we really believe that 2-week period gives us that 2-week dead period gives us the best opportunity to begin.
You had an athletic directors meeting today, correct?
Yes, ma'am, I did.
And they were all receptive and.
Yes, ma'am. That was the opinion of everyone. Yes,
Okay.
ma'am.
And can you start back over for me? What's happening to conditioning and drills? What were the dates?
We will be suspending those as soon as the Thanksgiving break begins. Our plan was to run them through the following week as well through December 4th, but instead we are going to suspend as of next Wednesday, the 25th of November. And there'll be no activities from that point until tryouts would, we hope, begin on Monday, the 14th of December. The 14th of December still, if we're able to begin, still does give us 20 days so that we would be able to start competition on the originally planned date of January 4th. Again, that is if everything works out perfectly, and you know, we have to plan for a perfect world and then react accordingly. But that would not delay the start of the competition season by moving the start of tryouts and practices from December 7th to December 14th.
And that was going to be my next question, and that's great if it doesn't mess up the playing season. And then lastly, what are the other jurisdictions doing? Have you heard yet what other people are doing, or you're just going to do what you're doing and hope they do accordingly?
A lot of jurisdictions most of my colleagues are very pessimistic that winter sports will be able to begin. And I'll be honest, I'm hopeful, but I'm not overly optimistic. And I know Mr. Singer wants to weigh in as well, with the numbers continuing to rise. And specifically when the Maryland Department of Health lists the idea of modifications for close contact sports, and 2 of the 3 sports mentioned are basketball and wrestling, and they're indoors. That's what gives us the greatest pause. And obviously football being the other, but that one doesn't come up just yet.
Mr. Duffy, you're
Yes,
planning to still have kids come for workouts, even though schools are going to be going virtual starting tomorrow. You're going to do workouts. I'm sorry, it doesn't make sense to me. if schools are not allowed to be at least hybrid mode, how can we justify, not you personally, but how can we, the Board of Ed, which I'm not a vote on, but how can we justify having kids come for working out? And I just don't get that. And Mike, also, just to kind of extend this, when you're planning to start the next season, or session of sports in December, you're hoping that we're in hybrid at that time and not still in virtual. Is that correct? Because if we're still virtual, are you planning to start? A lot of questions.
Yes, sir. And I understand exactly what you're saying, Mr. Frazier. Our pods of workouts were taking place before the high schools were in hybrid. They've been taking place since October, I believe, maybe late September, when the high schools have been in virtual as well. So for the high schools in particular, that's not a change. This is also all taking place outdoors, which is a lower risk area, and they are all in small groups with more distance. So I agree with all the points you're raising. I just want to provide some context to what is taking place. As far as beginning winter sports, it is our hope to begin them within the calendar as provided by Dr. Salmon and the MPSSAA. As I said, I'm not sure that can happen. And realistically, if we can't begin in December, I will be honest with everyone, I think our chances of having a winter season are very slim. Because realistically, if we have to wait until January, after another break time delay, as such as winter break, I think it behooves us to provide that 2-week period again for that quarantine bubble time, for lack of a better term. And at that point, you still then need 20 days until you can start. So you're getting to winter till you can start competition. So then you're really talking about a 1-week winter season of competition. And I'm not sure that's in our students' best interest either. And that was, to your earlier question, Ms. Herbert, that was also the opinion and belief of all the athletic directors this morning.
All right, and Mr. Singer, you had wanted to comment?
Yeah, I just wanted to comment on a couple of things. One is, I understand the commissioner's concern about, we're closing down the hybrid model and going back all virtual tomorrow. But I do think that we've reviewed the plans that the school system had for these practices, the off-season practices that they're doing, and they are keeping the kids 6 feet apart. I think there's very little risk of transmission if we're having no contact and we're outside and we're at least 6 feet apart, and it does give the kids something to do that I think is really low risk. Now, when we talk about winter sports, that's an entirely different conversation, because when we first talked about winter sports, and I was kind of encouraging the Secretary Salmon to let you guys start your winter sports season in December, we were kind of at a point where we were approaching some of those metrics that would have made transmission relatively low risk in schools. What I'm really concerned about, and you got to think about this from a practical sense, we have all these mitigation measures in effect during the school day, and to keep people from spreading the disease. I'm just imagining, and I wrestled, and at risk of upsetting my nephew, who's a wrestler in Carroll County school systems, I just have a difficult time with our cases where they are now. Without these numbers coming down very significantly and getting closer to where there's a lot less risk of transmission, I can't imagine putting 30 or 40 wrestlers in a wrestling room because all those folks are going to be close contacts, period. You get one kid that has COVID, and all of a sudden you got 40 kids in quarantine. And potentially any of those kids could be infected, because I'll tell you, the wrestling room is, from my perspective, it's not much different than the close contact you have with sleepovers. I really think these numbers are going to have to come down significantly for you all to really seriously consider having winter sports. The inside is worse. These are two of the most close contact sports. We talk about having winter sports when you're talking about basketball and wrestling, and I kind of joke around with folks that I guess we're going to have to send people to the Harry Potter school so they can learn levitation spells be able to do wrestling without close contact. I mean, CDC suggests that you're supposed to somehow modify these sports so that people don't have close contact. I don't know how you do that with wrestling, and I don't know how you do that with basketball. I don't even know what that would look like. But I will tell you, with these case rates, it just doesn't make any sense to me that we'd be considering starting sports unless these case rates come down very significantly, because there are going to be kids that we know that there are going to be kids that are going to be infected with COVID. We know if we send kids back in the hybrid, and I've told people this from the very beginning, that we're going to expect to see small outbreaks, but we want to limit those outbreaks. There's no way we're going to limit the outbreaks among sports teams. So unless our case rates are significantly lower, I'm telling you, the risk of sports is going to ruin your risk of having academics if these case rates are as high as they are. So unless we get back down at least closer to those numbers where we're at least down in the 30s to 50s, I think that's a real stretch to think you can do this.
Mr. Singer, and I'm curious, I have a number of concerns about that. Number one, wrestling's been going on, and Eldersburg's having some serious events. My bias, they're having people come from out of the county and doing some serious events. And I understand your concern, but my concern is, and I brought this up when we toyed with rec sports a few months ago, if we don't do it, I can tell you the high school kids already have plans for where they're going to practice and where they're going to compete, and it's going to be at paid facilities that don't have near the rules Carroll County Public Schools have. And that's my biggest concern is, aren't we better off furnishing something for the kids that has rules and regulations, and we make them follow them, and then have them be renegade, and they will be renegade. And have we seen any cases from the wrestling that's been going on for months?
So, Mr. Kyler, I can tell you, I'm not aware of any cases we've had that have specifically been related to wrestling. We have had outbreaks related to other sports that have been going on for a number of months, and some of these are outdoors. And I'm not sure. I know I've talked to some of the folks that are trying to run some of these programs, and they're trying to keep the groups to less than 3 or 4 that are working out together and keep them spaced out and all as best they can. And maybe they're having some success with that. But if you get a high school, I'm just imagining your high school wrestling rooms the way that they are, and being enclosed the way that they are. You got, ultimately it's your decision to make, and I'm just telling you what I think, and I got to be honest about it. I mean, that's really a tough one for me. I think maybe the case rates will do something we don't expect them to do, but I don't see us being there come December. But ultimately you guys have to make that decision, and I just, every time I think about it, I think, okay, so we're making kids stay as close to 6 feet apart as we can during the school day, and we're making them wear face coverings so that they're not transmitting the disease to each other, and we're really doing a good job of all this, and we're not having outbreaks because of all the mitigation factors that we're putting in effect in our schools, and we know those mitigation factors work, and then we're going to throw them out the window and throw 30 to 40 kids together in close contact after school. I don't know. I just don't know how, if education's the priority, how we support that. And I don't like saying it, and it's not going to make people happy, but it is what it is.
But my worry is those same 30 or 40 will be at Copper Mine or the Eldersburg facility, and doing it with less restrictions. And that, because I understand what you're saying, and it's those rooms are by design pretty close. It's a tough situation.
So I think...
And one other thing I wanted to mention, as far as whether we're virtual or hybrid, most of the rest of the state, and we talk it in the May meetings, they were planning on doing the sports a while back, at December 7th, and they had no plans to be hybrid, most of them. So the virtual hybrid versus sports, I'm not sure, at least the rest of the counties have that concern.
Mr. Duffy, I wanted to clarify something too. I'm pretty sure we had discussed that there was going to be guidelines put in place as far as fan base, who can be there, who cannot be there, the different protocols are going to be taking place. And they were pretty strict from what I understood too. Please understand, I'm not trying to discount rec councils whatsoever, okay? I'm not. But the things that I have seen out on baseball fields, football fields from rec councils, high school sports was like locked down compared to what I've seen out in these fields. Just this past weekend, the hundreds of people I saw on a football field for Little League football was insane. And I literally, I had to take a step back and I was like, this is crazy. We're having our numbers increase and some of these rec counselors are still like massive amount of people. And they're coming in from all over the place. High school sports, we have a pretty solid plan in place to make sure it's not massively crowded. I think it's something that we've shown in good detail on, that we've had good discussions on. And again, it's something out in the public. We have to have the community help us out. If we want to continue with sports, sports is good for kids. It produces the endorphins, they're happier, physical activity, they're not doing things they shouldn't be doing. But we also need to understand that, there's got to be larger restrictions put into place in the rec councils, especially if the high schools are ready to do this and they can make it solid. They can make sure that everything's being followed correctly.
I don't think that we have any authority over rec councils, so we can't make recommendations to do that. We can.
And I'm involved with a fair number of those programs, and I don't see the abuse. I know there's been some cases, I think, in some of the soccer programs, but I'm not sure how many. But I know Parks and Rec, they each have to have plans, they each have to have protocol. I've seen softball coaches fight because one tells the other his players aren't quite socially distanced on the bench. I think they work very hard to make it good for them, and I think our kids need it. And like I say, there's Copper Mine just bought 2 more facilities in Carroll County. I'm sure, well, almost in Carroll County. I'm sure they've got room, and it'll be zero rules.
I wasn't discounting rec programs whatsoever. I was saying that, our high school sports,
Oh,
we
I
have
agree.
a solid
We're
plan.
more regulated.
Where unfortunately, in some rec programs, there's leniency. It's not being monitored. It's, so, if we've got a really good plan for high school sports, I think, as long as we can keep it down, need community help to do it, we can continue with stuff, but we've got to have help with all of this.
No, and I agree with all the points that you were making. You had said something about we need more restrictions on rec council. I would say no. We can make a plea to the community to try to be responsible about everything that you're doing, because we need community transmission to come down in order for us to open the schools and, the impact that this has on sports. So we can make that plea to the community, right, to try to help us out from that regard. But I don't think that we should be saying that there need to be more restrictions.
No,
put in
I
place.
mean,
Me
just
neither. I
saying-
think Jeff Daggetts and his group they draw a pretty hard line, and each program has plans. With the COVID days, I think they all have Mr. Singer on speed dial. I don't know how he talks to everybody he talks to, but I know they run stuff by him. They take it very seriously, and that's why I want to promote. We need our rec sports with rules. We need our high school sports with rules. If it goes to the renegade teams, I guarantee you there won't be rules.
Well, that's the thing too, is if we don't proceed in some way, you're going to see them go back to the rec councils. Yeah, I know we can't control what happens with them, but I was just saying that it is the unfortunate. High schools, we can control something else, rec programs, we can't. But
Right.
it's just the
And
showing of-
there are protocols in place, so we can just
Yes.
ask the community to follow those protocols to help us from that perspective. Right. Okay.
I would like to say something. We took away sports from those juniors last spring. I do not want to take things away from them this fall, and we have, and we need to try to go forward. And I will say that we do have protocols in effect, and I will tell you, our protocols will be tougher than what I saw on Saturday afternoon when I went through Hampstead and I saw all 30 kids at one basketball court. So I know we can, I think we can do a better job, and I hope we can go forward with this. Our senior athletes need this. They really do. Because I've been there with all those kids, those athletes before, and I know how important athletics is to these students. And but I think we do a good job of following protocols, and I know we'll do the best we can. And if the numbers don't come down, then I do realize what will happen. So.
And Mr. Duffy, the recommendation that you put on the table was to just delay the start of the winter sports season until December 14th.
Yes, ma'am. And I think we need to make a reevaluation at the board meeting prior on the 9th. Sorry, to make things going through my head. Numbers weren't sticking for a minute. I think we need to look at the numbers and the data at that point, because it's not realistic to look at something on Sunday the 13th and say, hey, everybody, I know you were all pumped up, we were ready to go, but the numbers are through the roof. And I think we need to be very realistic about where the numbers are. Mr. Frazier made some great points, and I don't want to dismiss those. I think we need to be very cautious. And what has happened in other community groups gives us data, but it's still, when we're putting the school system as a part of it, I think we need to be cautious and proceed with caution and be very clear of what our end goal is and how what we're doing is supporting the educational environment. And I think that needs to continue to be our focus throughout all of our decisions. And we stand ready to support, but I just want to make sure, but we think that gives us the best opportunity. But as I said, I really believe the 2-week, if there is a long break, be it Thanksgiving or winter break, and then we have to start something afterwards, I think it really needs that 2-week period to do, as Ms. Taglia so eloquently put it, ask everyone to do the right thing and be supportive and help us get to that point.
Do we want to bring that back up on the 2nd, or do we need to make a vote tonight? I mean, we're going to be looking at numbers on the 2nd.
Right. I think we should add it to the agenda for the
Right.
evaluation on December 2nd.
Yeah, I think we need to do that before we move on. I mean, we'll get a better idea to see which way these numbers are going.
But I think, and nobody has an issue with Mr. Duffy. He's now prolonged it another week. It's almost a month from now.
Right.
But the competitive season can start when it would have. Nobody has an issue
Right.
with that. And like everything else, we just need to evaluate as we go.
Right, that's why that's why I
Right.
said that. We need to bring that back to the table.
That way,
On
Mr.
December
Duffy
2nd.
has to be at a couple more meetings.
That's right.
And truly, who would not want that opportunity?
I appreciate that at this time of night. And yes.
Thank you, Mr. Duffy. All right, so I don't think we have to take a vote on that. I think we just state that,
think
okay,
so.
so the current conditioning and activities will end on 11/25, right? We will be postponing the winter season start date until December 14th, which should have no impact on the competitive schedule. And this subject will be on the agenda for December 2nd for reevaluation, just like the hybrid model is.
Okay, and if necessary, on the 9th as well, we can take a look at it both.
Correct.
weeks.
Yep.
Correct.
Okay.
Everyone good with that?
Yep.
Okay. All right, so board members, then with that, do we have any other new business?
I do. Today happens to be Mrs. Herbert's birthday, and I don't want to steal her thunder, but I remember when she taught me in school.
Oh. Kenny Kyler, I can't believe you did that.
Happy birthday, Mrs.
Happy
Herbert.
birthday, Mrs. Herbert. And I might as well tell you all, you're probably all sitting there wondering how old. I'm 69 years old and I'm still kicking. So. Daggone you, Kenny.
His time
That's
is
all
coming.
right. What a birthday party we've had tonight.
Yeah, right, right.
Miss Herbert,
And I even have a piece of cake you all gave me.
don't forget, his is coming up too.
I know.
So it's all right.
You can get them back.
Ugh.
Okay, board members, any other new business?
Yeah, I have something I'd like to bring up, Donna, if that's all right.
Okay, go ahead, Commissioner Frazier.
All right, I have a little statement I want to read. I want to express my disappointment and frankly amazement at how I have been treated by a few board members during the last few meetings. I've been constantly interrupted, cut off, and talked over when trying to speak. Matter of fact, at the last meeting, I started talking and heard a lot of noise. I thought my connection was bad, so I stopped talking, only to find out that it wasn't a connection, it was Ms. Battaglia talking over me. I was astounded. As an ex-official member of the board, I have the same rights to express my opinion as any other board member. I just don't have the right to vote. I recently received an email that a teacher forwarded me that she was sent by Mr. Kyler. I'd like to read part of that. It says, Mr. Frazier came to the meeting with talking points from a minority of teachers that are on Facebook. Several people texted or called me prior to the meeting upset about that. Now, how they would call or text you prior to the meeting, I have no idea. If you noticed, he did not say one word after that portion of the meeting. He should not be part of our meetings with a personal agenda.
And I stand by every word of that, sir. And I knew what you were going to say that night before you talked because I was told about on the Facebook talking points. Go ahead. If we're going to do personal attacks at a meeting now, let's have a free-for-all. And you just did it with Tara.
All right. Mr. Kyler basically called me a liar by saying that my talking points were from Facebook and not from going to schools and talking to teachers and staff. But you know what? I do have an agenda when it comes to the meetings. And that agenda is to make Carroll County Public Schools the best it can possibly be for students and staff. And I would think that every board member has a similar agenda. If you don't have an agenda to help the students, and you're going to basically call elected officials liars and then put it in writing, Mr. Kyler, perhaps the Board of Education is not the place for you. My aim in going to schools and bringing concerns back to the board is to point out that the current way we're doing hybrid is not the best for the students, and the workload is unsustainable by the staff. I would like to think these are concerns the school board should address as well. Thank you.
Mr. Frazier.
Thank you, sir.
Mr. Frazier, I do want to correct you on something.
I'm sorry?
Last week when you were speaking and you had said that the numbers would increase because of the schools, I was simply correcting you immediately because that is not what the case was per Mr. Singer last week. That is why I interrupted you. We already have a problem where there is false information being spread all the time on social media with false quotes and false statements. I was clearly, immediately trying to correct the statement that you made.
If you thought what I was saying was incorrect information, you could wait till I finished talking and then say it. More people would have heard what you had to say. But the way you jumped over it before I even got finished speaking, it was unbelievable. And in fact, I didn't say that the number of cases were rising because of schools. I said we don't really know because children could be asymptomatic and spreading the virus. There's a difference.
No, unfortunately,
Okay,
sir, that's not what you said, but whatever.
Okay. I think I'm just going to say that we heard what you had to say. I'm sorry that it needed to be said tonight because I thought we did a really good job of hearing everyone and trying to bring the temperature down. Emotions are running high, and we tried to bring the temperature down. So we're not going to have a continued back and forth.
Well, can I just say one thing? Mr. Fraser, I have texted you after consecutive meetings saying I'd love to talk with you about some of this stuff, and I've never seen a return. So I have tried to reach out, and I have no idea what email you're talking about, but I believe you. But again, it's what it is what it is.
Where are you texting me? Because to be honest with you, I don't recall seeing a text from you, Mr. Tyler.
Yeah, maybe I have the wrong. I have you in my phone, and I've been texting. I'll send you an email tomorrow and clarify it.
Send it to the County Board of Commissioners. That way I'm sure I'll get it.
Okay.
All right, and I just do want to say for the record that we all have been doing exactly what we think is in the best interest of the students. We all have that agenda, and I think that we've proven that time and time again. So with that being said, board members, any other new or unfinished business? All right, then I will ask for a motion to adjourn.
So moved.
Moved by Ms. Herbert,
I'll second that.
seconded by Dr. Dorsey. All those in favor, can I get a verbal aye, please?
Aye.
Aye. Any opposed? That passes unanimously. Thank you, everyone, and have a good night.